Okay. So what I would like to do, if whatever amount of people are here, what I would like to do, and this is especially true for you, Vern, is that I would like to make this basics group. There were a whole bunch of things. I sent out stuff. Sam probably wisely said, "Are you out of your mind for like that thing is so complicated." It isn't. It isn't. It is. Bifurcation is simply a kind of a way that one thing becomes two things by nature. And so it's the basis of everything that we do. But yeah, setting that aside, what I'd like to do actually in this group is to have people raise things that they feel inadequate about in emergence. And, either Sam or I, or Sam and I, will do our best to give some kind of a starting point for learning those things. Um, does that make sense, Sam?
Yeah, that's fine. Yeah, yeah.
Yeah, because I think focusing on a single topic probably, um, yeah, yeah. The big deal about coming to the actual seminar is that you get to ask questions and you get to be confused in real time. But what's really important is to recognize that for me, I'm speaking for me, if I don't know what confuses a person, I actually don't know what I need to improve in what I'm saying or speaking about. What I need to think more about how do I talk about that. Um, yeah, this morning I'm writing the final, the appendix of the new book. It's the end of the book, and the appendix is the tests for the different things, uh, the tests for the different things that we can measure in personality, like mind-body orientations. What I'm writing this morning, and I'm writing um, a description of that I'm surprised by because I'm saying in like a relatively few paragraphs something that took me like a whole chapter in the first book. So, and I'm leaving things out, which is just as important, and saying if you need more information, here's where to go, you know. But that generally, when I speak about something in emergence, I don't know how much to say and how much to leave out. And I think that that's the basic thing that each of us could, if we can today, even you, Sam, take away as this is one of the things we face. Like in trying to tell somebody else what this is, or even describe it to somebody who's open and asking us, and not closed minded, the most difficult thing to me is to know what do you say and what do you leave out? How do you have that conversation?
It's a painful thing, Steve. It's making me think of this book I read like a long time ago called it was called A Complete Guide to Asperger's Syndrome. And in the
Complete.
in right in the book, they're talking about, and I've definitely mentioned this to somebody in here. I think maybe or Clancy, but they're describing a scene where the child that has Asperger's that just came home from school, and the guy is saying, if you ask your kid that has autism, how was school today? What's going to happen in the inner world of that person is,
Yes.
what are you asking me? Are you asking me, did I learn anything? Are you asking, was anyone mean to me? Are you
Yes.
asking if
Yes.
I ate my lunch?
Yes.
And they said that the crisis that comes up for the person is that the person with Asperger's will either A, give every single detail in the hopes that something in there is what you're
In the
asking
hopes
for.
that Sarah is the one on the other end of it,
Sarah
or
would like
Linda.
that level of detail. Or they said that they would give almost no detail and just give up, like just say it was fine, because it's so hopeless to and painful to try to figure out what to say, what not to say. And even though that's a book about Asperger's, I do think everybody has some version of that, which is how many it may not be as pronounced the pain, but
Okay.
yeah.
So this by nature brings up something that is a basic in emergence and especially within the therapy and especially within diagnosis and treatment. So the thing that just got raised by Sam, and if uh, some, some of you, most of you probably have had a course in diagnosis or something in school, an abomination. Um, uh, in emergence, the symptoms of anything, any symptoms at all, but Sam is describing something that are the symptoms of having, autism spectrum disorder level 1, Asperger's, right? So the symptoms are always, that's a lot. This is the thing that pisses people off about emergence, that I can fucking claim that there's an always in human nature. The symptoms are always an exaggerated and distorted version of some behavior, mind way of thinking, and so on, from early in child development. A time in which the the symptoms were normal. An example. So I don't remember. I don't even know how to pronounce this from the diagnostic manual. I think it's factitious or something disorder. Do you know that one, Vern? It's a lie. It's a person who's a liar, but pathological liar. Like they lie when the truth will do. Have you ever had somebody like that you know of? Okay, wait. You look like you were married to somebody like that. That's what that face looks like. No, but in the you have had so many people pass through your work, so many hundreds and hundreds of people. In my lifetime, I have only had 3 people who had this disorder. They lied when it didn't matter. They lied when the truth would do.
Yeah.
So, okay. So now, is there a time when that happens? And yes, it is. There's a time in child development where the child doesn't fully understand language, and the things that they say are fucking made up. And they have the correct pattern of language, like sentences and things like that, or facial expressions, but they're made up. Another thing we could say is that in schizophrenia, one of the prime symptoms is that you hallucinate people. You see people or hear voices or this or that, and so at age 4, roughly, fourth year of life or age 4, children have imaginary friends, and so then it's normal. And in schizophrenia, which is largely onset like maybe 19 or 20, 21, it's not normal. And it's a distorted and exaggerated version of that. So what you were saying, Sam, is absolutely true. In other words, to say somebody has autism means to say that it's frequent, that the social version of a sentence, how are you, is different from the literal version of a sentence, how are you? How was school today? Like the thing you said, probably any question about how that is about a person, how did you sleep last night? How did the test turn out? How hard was the hike? Like it doesn't matter. That word is confusing to anybody who has autism, the mental kind, level 1 or what used to be called Asperger's. So was there a time when people only understood literal things? Yes. When you're 2 years old and somebody says pen, and the little kid says pen, right? And then the little kid smiles because you smile, pen, and they say their baby version of pen, right? Pen. Okay. But then what happens with the little kid? Well, the little kid knows that they pleased you. You just got excited. So what do? They say the word again, pen. Then they say it again, pen, pen, until you want to kill them with the pen. Okay, so I'm going to stop now, but this is the first point that has come up today naturally in what Sam raised, which is the idea that in emergence, all symptoms that we look to treat had an origin early in a person's life where it was completely normal to have those symptoms. And that the later in life part is one, it's at the wrong time. It's like wearing a bathing suit in the winter, wrong time. Or it's distorted and exaggerated, like it's too much, or it happens too frequently. It's invasive. Right. I mean, even the last thing that occurs to me, even shoplifting. Like, there's a point at which little kids just take shit because they don't understand ownership.
Mm.
So a shoplifter has this same exact thing happening inside them. Of course, their brains know better. There's the mental voices, but when they're doing it, they're just doing the shit that would have happened at 3.
Yeah,
Anyway,
I literally remember being like 3 and just this seeing something and just being like, I just want that, and I just put it in my pocket, and then just
exactly,
got roasted,
exactly.
and had to go back to the store and do the whole whatever. But I mean, I can remember learning that oh yeah, like the idea of possession or whatever you want to call it.
And everyone noticed Sam's smile. The pleasant surprise still exists, and he's almost 40 years later from learning that lesson. That's our evidence that at one point you had an injury, and now it's become a part of your pleasant nature to know. It's knowledge.
Mm.
Steve, what about anxiety? This is very, very helpful. Helpful for anybody else, but it's very
Oh,
helpful.
good. Okay.
Yeah, yeah. This is very, very. Yeah. What about anxiety?
Okay.
Of anxiety.
Okay. So, um, as is a strange thing in our community, many people arrive um, spending much of their time. Okay, let me do it simpler. A bunch of people are 3s. My provisional sense of that being true. Up to now, what I know, blah, blah, blah. Okay.
Mm.
But arrived or frequently spend a lot of time upside down.
Mm.
Number one, how do I know upside down? Is it just because it's the other part? No. It's because when you're upside down, you're compelled to do the other part. You feel compelled. You feel pressured. You feel great anxiety if you're not doing the thing.
Mm.
So that's a start, Vern. This is a huge topic, obviously, because anxiety, wow. And this is a great question. Great. But when a person is, I see it, Sam, when a person is upside down, that is the most immediate, primitive sense of urgency that you can feel as a person. So, for instance, if a person is a 4 and they're normally in a U state, they're not compelled to give. They just feel this is a natural thing. Um, but if when they flip, right, they are compelled to get. And if you do not immediately give to them, you get punished. They're not compelled to punish, they're compelled to get. So their me state becomes an urgent me state. And if another person doesn't see the urgency, wow,
Mm.
lashing out. But beneath that is, I see it, Clance, is the anxiety. I haven't gotten. This isn't right. I've been giving to you. I haven't gotten. You know, and anxiety, anxiety, anxiety until there's a outburst. Sam and then Clancy. Sam?
I'll let Clancy go first because
Well, it's okay. You answered my question, Steve, just
I
then.
I did?
Yeah, thank you. Yeah.
yeah, I'm thinking about that. That idea is new to me. that is so primitive, the upside down thing. But I was thinking also like when Vern talked about like we're talking about all these things that are like developmental or and I'm asking myself, I'm not going to go there because I want to go to something more personal, but like, is it just is does it, the anxiety of adult is it different than the anxiety of a child? That's like the way thing. But before that, I want to just ask: can people access your? Can you access your anxiety as you had as a child? Can people all in here access that? Like, can you access a scene of anxiety when you were a kid? Sarah, you're saying no immediately.
No, no. Clancy?
What
I
do
was going
you
to answer. Yeah. What,
can
Clancy?
you like how old is a kid? Like teenager or like
I would say under 7 based on emergence
oh,
measurements before age 7. So
okay.
before the introduction of time is how I would define it.
Okay.
So, first of all,
A lot of ideas there.
there's a lot of ideas there, and I want to overlook some of them, but I
Good.
need to say one. And the one is that although we don't speak about it much, there is a concept from the therapy book called wound
Mhm.
chains, which basically means that if at 14 you have, say, an anxiety of having to say hello to a new person, okay, and you don't run away. In other words, it's within a normal range. People have, I don't remember this person's name, or did I meet them before, and I got to hurt their feelings. Like we have a bunch of things about this. But if it happens at that age, again, this is almost always, because it is possible to get an injury at 14 and have it happen. But even then, there will be something that we can trace back on that chain to before age 7. My evidence is that when we relive that state, the state that you're asking about, Sam, we have no sense of time.
Mm.
And that sense of time occurs only before you learn to tell time. So between maybe late 6 and late 7, we learn. Linda?
I had an incident this morning and one of my wounds got triggered being left just by saying goodbye to Chris at the door this morning and I'm all emotional. And then I realized I felt so fucking young.
Hmm.
So I think when I'm in that anxiety and that thing, I am at that age. Like, so the original event must have been someone literally walking out the fucking door.
Good. Slow down.
And
Because slow down.
no, I'm sorry.
Yes. No. Don't know about you. You are correct. But I want to stay on Vern's question and like kind of add in the thing that Sam's saying, but I want to stay on Vern's question. I don't want to forget what she's asking about, which is a general thing. I see you, Eric. A general thing about how does this earlier in life thing connect to or not connect to having anxiety, and then I immediately go to the most important thing of all, which is not an injury, it's not a situational thing, it is simply that if we are upside down, there's an infinite amount of things that can flip us, but if we are upside down, we will feel that anxiety, and I call that general experience before behavior urges, but we will feel urgency. And
Yeah.
all urges have urgency. It's just that our adult minds tamp it down. We do things to ignore it or overlook it or talk ourselves out of it or whatever, or numb ourselves, like Linda at the door. I don't want to open it up for a discussion, but while you're at the door, you're obviously not your adult age because there's no timeline. I mean, Chris is never coming back, and this is the last time you'll ever see him. No, and I'm glad you're laughing, but it
I'm
is
laughing because when I felt young and I
yeah.
realized that, I stopped crying immediately.
Okay. Now, this is critical because Vern's question about anxiety and we are talking about symptoms, the treatment for any of the things we're talking about is to get the person to go to the age where it would have been normal in one way or another. We don't need to get them to go to the event. I didn't forget you, Eric. We didn't need to get them to find the injury. The first thing we should be doing is get them to go to that time in their life. And this is why learning child development, especially between birth and 7, but extremely between birth and 4, is so important, because we can then identify the age at which the thing happened based on what it looks like. What are we seeing?
Should I have stood there?
What's that?
Should I have stood there then in the suffering and the urgency and
The piece that you said, I don't want to go into it because that's for injuries, and if that comes up later, great. I don't want to go further. But the idea that you can say to yourself, it's a representative event, is one of the ways that we find out, well, what kind of a scene must this have been earlier in life? And you were saying someone must have been leaving, and you saw them walking through the door. Okay. Anyway, Eric?
Yeah, I just had a question after you answered Vern's question, which is like, couldn't we really say that about all the fractals? That, whether it's scene story or majority, minority, that the difference would generate anxiety or could generate anxiety.
100. Okay. This is a really excellent thing that you're saying, Eric, because all of the personality theory area of emergence is relational, meaning we only make measurements when we see two people interact. Now, there is the lesser version of this when a person is talking about that they're interacting with another part of themselves. But generally, the best observations for these things are made seeing how you interact with another person. Okay, so the differences between the two people. Okay, so for instance, um,
Some
let me.
examples of
What's that?
I have a clear example of this from
Okay,
this
good,
morning.
Sam. Tell me.
I walked into the post office with Clancy. I have like 30 packages I'm giving, right? I walk up to the thing and I don't need anything from the post office this day. There's a guy standing there. He's in his 30s. He's working there. I just drop the packages. I don't need them to scan it because I've already scanned the things on my phone. And the guy says, if you ever want to, you can just, we ask people that you could just leave them on one of the empty postal counters. And that gave me immediately extreme urgency. I said, "Oh, do you want me to put them there now?" And he was like, "No, it's fine." But I really had a really intense urgency when he said that.
Okay,
Like
great,
very, very intense.
great. So let me ask, if you had the extreme urgency, you were regressed. I want you to
Yes.
put this together not as a casual statement. If you have extreme urgency, anxiety, if you have a higher than normal level of anxiety, you are regressed. Again, this is one of these things where it's simply a label, like the candle is lit. It's not a made up idea. Regression simply is the label that we put on people when you go to a way younger age, generally below age 7.
Yeah, and this felt very young and it's familiar. I know my inner stuff enough I know this is very familiar to me, which is like my best friend's mother was very punishing, and I was not very socialized. So there's this thing of I should have known this rule. I get in trouble for rules that no one even taught me, and then I quickly want to try to meet the rule, and I'm in this whole thing where I'm like pretty urgent and sort of mildly afraid of this person. But then I look to Clancy, and Clancy likes this person, and that
Yeah.
kind of breaks me out of the loop where I'm like, oh, this nothing bad is happening. I'm
Ah,
just in some fucking
Well,
punishment thing.
he
Go
was
ahead.
trying to give to you. Like he was trying to give to you, you know. He wasn't saying this is what I want. He was saying it'll make it easier for you, you know.
go slow.
Sorry, you look blank. Yeah.
No, 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 no. You're doing fine, Clancy. Go slow.
Okay.
Really try and take in what just happened.
Okay.
All of you. Sam said about his level of anxiety, he could recognize it as this is not normal, and he's reliving something. And rather than just say a wound, because maybe yes, maybe no, but it can be socialization, it can
Yeah,
be
no, it
worldview.
doesn't feel like a wound because I went to this house with this person all the time and I would just get punished or in trouble. It was so commonplace. Like it could be a wound, but this is just part of my
Oh, well, I would
life.
absolutely say there
Yeah.
could be six wounds.
There
But,
is. There is.
but, but this is something I probably have never said to any of you. A constellation of wounds can create something that's like a cloud. We can't actually see it as one of the wounds. And it's best addressed initially as this cloud. And those clouds are like socialization or worldview um, clouds because they are, you can't pull apart the thing. There's interacting wounds.
The
And,
speed is so fast for me too, Steve. Like as
yeah,
soon as he said a rule that I was not aware of, I felt such an urgency to follow the rule.
right.
That it just to get out of the what I perceive as whatever stuff from this house that I went to that I'd get in trouble.
So this is um, again slow, so complicated, so many pieces in the air, and this is good.
It's
So
interesting because the reason I brought this piece up was the relational piece because emergence, the
that's
measurements
right.
are all relational. Me to him, me with Clancy
That's
and him,
correct.
me seeing.
That's correct.
That's why I thought it was a ripe
Oh,
example.
it's a good example because it has two different relationships. And then Clancy has two different relationships. And we
Mm.
can see them. And because of the differences, um, there either is the presence of anxiety or the lack of anxiety.
Yeah, Clance
Yeah.
had no anxiety in there, I would say.
You can see that it's pleasant for her that she can see that. Okay. No. So first word that jumps out is rule.
Mm.
Okay. And rules are socialization. So you can see that this is that part of you. Somebody might say worldview. No, worldview isn't rules. Worldview is how you have this internal simulation of the world. Socialization are the rules that we apply to the worldview.
It's interesting though, because the thing for me is I don't have rules in my head. But if somebody says the rule, then I that's part of it, is they said something that I perceive to be a rule of some kind, and that I was not aware of before.
Okay. This boy, this
Sarah
this is
and Linda are going,
yes.
yeah,
Okay. Before we go there, okay. No. Okay. Who was first, Sarah or Linda?
Sarah.
I just have a question, and I don't know if we want to answer it now or if it's applicable. So I'll ask,
Raise the question. If we need to, we'll put it aside. Okay.
but what's the difference between anxiety knowing that you're regressed or flipped versus anxiety in like your natural state?
That's
Hmm.
a good question.
Hold it.
Yeah.
We
That's a
will
cool
come
question.
back. That is important. Linda?
I'm thinking about OCPD, how there's an over preoccupation with rules. Like like everything, my fucking life is run on like, oh my God, I'm breaking some rule, I'm gonna get in trouble. Like about putting an air conditioner in my kitchen window. They make these ACs now where you put the window in between the two things. And Chris is like, yeah, let's get one. I'm like, oh fuck, I live in a condo. There's probably some fucking rule that we can't have window ACs because we all have central air, but my central air like my life is preoccupied with rules. So whenever, like Sam, if I thought I did something wrong somewhere,
Hmm.
I get
Interesting,
anxiety.
Linda.
Okay.
Yeah.
Pause, pause, pause. I'm trying to make the things individually more memorable. And holy shit. I mean, Vern, you couldn't have asked a more complicated question, which is good. Do you understand that?
Oh yeah.
These are the meta questions that never properly get addressed in school. We even don't take them apart well ourselves. We just kind of fly by what we assume. So immediately there are three differences between Linda, Sam, and Clancy. I'm leaving Sarah out on purpose because her question is a separate question, but because the three of you react to rules in this case differently. I'll start with Sam and Linda because you're a pair of opposites. In only based on what I've observed in the past 10 minutes, okay? You hear what I'm saying? This is not me making some gross assessment of your personalities. It is simply based on what we just observed. And Sam, you seem surprised by the fact that a rule exists where you didn't know
Yeah,
a rule exists. Okay?
that's correct.
And Linda
I
is
had
the
no ability to
opposite.
imagine the rule. Yeah.
Okay, wait. And Linda can't imagine there not being a rule. Okay, but this is so important. This is so important because we could then say that pretty much everybody who gets anxious a significant amount either is more like Sam or more like Linda. Either they don't normally think about a rule must exist, so when one gets told you panic, or Linda, where she can't imagine a rule doesn't exist. And if a rule doesn't exist, if someone tells her that, she doesn't believe it. She says there must be a rule there.
Eric just wrote in the chat that I make up rules to worry
Yeah,
about.
yeah, there you go. That's even more. If nobody knows the rule, then you make up a rule because there must be a rule. And Sam will do, what? He's panicked
Just
because
stepping on
what
the
the
landmine.
fuck? Nobody told me that rule existed.
I think
Okay.
every single rule I got, every single thing I got punished for at that house, that not a single one did I know about
Yeah,
or was taught beforehand. It was as if I just should know them.
right. So this is important. Each of you, if we stopped right now at 10:36 and the two of you took away that thing and that was all you took away, if you write it down, and what am I saying? What write down? I'm saying write down the both of you. Sam, you write down you and Linda. Linda, you write down you and Sam. And you
No.
write that pair of opposites down. What we just did in real time is discover an actual pair of opposites in human nature that I did not know existed 5 minutes ago. I didn't know this. I didn't know to think about it. We just discovered it. Why? Because one, we are looking at early in life and how a pattern later in life that causes suffering always has roots in a time earlier in life. And two, Vern's question about anxiety, you know, and the thing that's in the air, like Sarah's question, is there normal anxiety? Is there abnormal anxiety? I could say, So, but before I go to Sarah and Eric, so it has to be added in order to understand this is that here's Sam, a rule exists. Here's Linda, of course a rule exists. What is it? Tell it to me. And Sam's over there, a rule exists? I don't want to hear it. It's making me anxious. Fuck off. And Linda's going, if you don't tell me the rule, I'm going to kill you. Okay. So we have this. But then in the middle of this is Clancy, who's literally in the picture. And what Clancy is saying is that she could read the man's motive, not infer. She could see it. And he was being kind and helpful. I think that's the word you were using.
Yeah.
Helpful.
Yeah.
Do you know if you want, you don't have to wait or you don't have to do this extra work. You can just leave them on the counter. Now before I go to Sarah and Eric, I want to add me. Because I had a reaction to what you said about leaving the packages, Sam. And I have no idea where this fits into the picture, but it isn't normal.
No.
My first, immediately when you said, the guy said that you can leave the packages over there, and there's like, whatever, 30 packages, right? My first thought was, I wouldn't fucking do that ever. Somebody's going to steal the motherfuckers.
I did have that. I had that thought. I did
But
have
that's
that
the,
thought.
but
Yeah.
that is the immediate first thought.
No.
Some motherfucker's gonna come in and take the goddamn things. Nobody said that they got them. There's no receipt going on here, and it's my word against the thief. And
Yeah.
I'm fucked, so I'm not doing that. Okay. So
I get that.
wait, but I have something about the rules and being forced to accept rules that I don't agree to.
Mm.
Oh, okay. Right, because
That's what
you're
I
thinking
have.
about it. Because you're like that rule will fuck me over possibly. So
Exactly.
yeah, because you're gonna get your
I
shit
feel
robbed. Yeah.
unsafe. Okay. So
Yeah, I get
Sarah
that.
and then Eric.
Oh, it was okay,
If
hold on. I
if
wanted
you
to know what was the difference between a flipped anxiety, like in a flip state, versus feeling natural anxiety. And I can give an example. Um, I started a new job and I've been feeling very comfortable. I'll have anxiety because again, I want to know the rules and I don't want to get in trouble. And yeah, but there was a new person that started this week, and I immediately was like, there was something about her that just struck me as uncomfortable and made me feel small. I felt regress. I felt myself go quiet. Like I just felt myself almost in a flip state. And I don't, I think I flip flop, but I don't know what's the difference between me as a 3 feeling anxious versus me as a
Okay,
4 feeling.
slowly. Okay, so slowly. So before I call on you, Eric, what I'm trying to do is consider how the people who aren't here who would watch this video, and we're doing great about not having any like personally revealing shit or anything. Um, the I'm trying to leave space in between these pieces because every single piece that we've been talking about is a big deal. Okay, so I'm not going to answer your question yet, Sarah, but I want anybody who's watching to look for the change in Sarah when she went from the anxiety of not knowing the rules, which is like a kind of a calm anxiety, versus the minute that she started talking about this other person, and when she said the word uncomfortable, she winced.
Mm-hmm.
Her eyes did like, and I'm exaggerating it obviously. Stop, Sarah. No. So we are seeing evidence here for the two anxieties that you're speaking about. I don't want to elaborate. The first anxiety about not knowing the rules. So, and Linda shares that. Linda shares it to the point of making up rules to anticipate. She infers rules, right? And the difference between that and Sam being shocked about a rule that he didn't know existed, right? So, okay. And the second thing that happened to you where you winced. So, what I was saying to you before about this cloud, Sam, I didn't see you wince. So, that does that mean there's no wound? It means there's no separate wound that you're experiencing, that one wound. If there's a
Mhm.
cloud, it's pulled in more than one direction, and all we can see is the exaggerated anxiety.
Mm.
I think every addict and alcoholic has these clouds of injuries, every single one, because we may not see the wince or flinch of an individual wound, but we know damn well what's happening is not normal. you know. Okay, Eric, then Clancy. Eric?
Yeah, I was just thinking about how much I identify with that thing with Linda, um and how well majority and minority socialization explains that, right? Like that, like, there's these rules that I'm always looking for. And I had like a really quick dumb story, but it's very simple. When I do laundry, I have those little pods, right? And on the package, there's drawings of laundry baskets to tell you how many pods to use. And this has been like fucking with my head every single time I do laundry because it's so imprecise. It just shows like a little bit outside of the basket, then you use three. If it's a little inside the basket, then you use two. So every single time I do laundry, I'm like, what is the fucking rule here? Like, is it two or is it three? Like, can I get a weight? Is there maybe a weighing way to do it? Like, where is the fucking rule? And Sam's like, who does laundry?
Exactly. I'm like, I don't, yeah.
All right.
That's so. Oh, Eric. I mean, I pour the detergent and I never think about how much or how little, or there's just nothing there.
But look at Clancy's face.
No, no, don't know. Well,
You,
plug your ears.
Sorry, I was thinking about something else. Sorry.
Oh,
okay.
good.
I
Oh,
wasn't
good.
in the
The
scene.
universe
It
spared.
was protecting me. Thank you.
Okay.
Mm.
Another thing to bring up. Eric is speaking about something that has to do with numbers. And this is one of the prime examples of a place where numbers in theory are perfect, but there's no such thing as numbers in the real world that are perfect. It all requires mental interventions. Okay, so to those things experienced as a rule are really confusing. Imagine if the rule for making an apple pie was a regular size apple pie takes 8 apples, go to the store, pick up the first 8, bring them home. Anybody who's ever made a pie knows that doesn't work. That's ridiculous. You're going to get a sour one, you're going to get one with worms in it, it's one too small, like who the hell knows? So while 8 apples is the recipe, and 3.5 pods may be the recipe, those are theoretical starting points. They have nothing, not nothing, they have little to do with the idea that counting numbers are statistical in the real world. In other words, 8 apples is a statistical average of how many apples that the pie takes. It's not 8 apples. And so 3.5 pods in the laundry is a statistical average for that size load in that size washer. But truthfully, your washing machine is going to make a difference. The amount of water that the machine puts in there is going to make a difference. Like, same as baking a pie. Now, let me come back to the thing that you were saying, though, Eric, is because this is a rule. Or is it a rule? And do you take it to be a rule?
Hmm.
That's probably true, Eric. Yeah. No, I
Well,
actually
yeah.
think statistics is there because it gives us the illusion that we have more control over life than we really do.
Mm.
I mean, think about the shit that you go through when you have to write up something from a patient for insurance. You have to statistically average everything that you say. You can't just say the reality of what just happened in an hour session in 6 lines. So you have to statistically average it down. You have to boil it down to something which is acceptable to an ignorant clerk who acts like a god and says, no, we're denying this claim. So, anyway, so the same with the thing with the laundry, Eric. There's nobody in the laundry room, Sam can vouch for this, that's going to punish you. Mary Rose doesn't live in the laundry room. Yours, anyway.
Well, exactly. Oh.
Well, I feel like this is breaking me down right now because it almost feels like every single time that I've been really needy for other people to give me answers,
Yeah.
like where I'm stuck on something or I'm stuck with a situation that it stems a little bit from this. Like I feel like I would love to be able to just break a rule and then be told I broke a rule rather than constantly look for rules that may not even exist.
That's, but now, Eric, here it is like 15 minutes into this thing, and I understand what you're saying in a way that I wouldn't have 20 minutes ago. So there's the idea of what we as a group are discovering together. And then there's the thing itself that we've discovered. That there is this, between this pair of opposites, you know, there must be rules. I want to know them. And I don't know those rules. And it's shocking when somebody tells me there's one. I don't even think about it. And I am more like Sam than the rest of you, I think, in this. I get shocked when I don't know a rule. Um, but I think, well, I'm not sure. A lot of what Sam said, I get afraid. I get afraid. But then I have the added additional bonus points for going, well, if I leave them on the counter, the motherfuckers are going to steal them. And it'll be my fault, and I'll have to pay for them. Sarah?
You just said you would get afraid if you didn't know the rule, right? Is that how you said it? But then what's the difference between that and me and Linda with the same fear of not knowing the rule?
Okay, good. I didn't say the complete sentence. In a situation where I didn't know there was a rule, and somebody tells me there's a rule, I get anxious. I don't get anxious thinking about there must be a rule. I don't have that shit.
Um,
Yeah, but
and
remember the simple way, Sarah, is that like Linda's surprised if there's no rule. I'm surprised there is a rule. Does that make
Excellent.
sense?
That's correct. And I would add, Linda gets anxious if she doesn't know the rule,
And
and
I'm
you
anxious
get
the rule.
anxious when you get told there's a rule that you didn't know about.
Oh yeah, the introduction of a rule that makes me feel like a little kid. I mean,
you,
I can't experience. I have a hard time experiencing it any other way.
Well, let
you,
me add, because there in everything in emergence there's four, so we're talking about two, right? But and I think I'm going to guess that Clancy probably is similar to me in this. When I learned that there were two meanings of how are you, one was a greeting and one was a question, I had way less anxiety, and I loved learning that. So,
Dave, can you say that again? I missed it. I'm sorry.
okay. So here we have, between Sam and Linda, and here's Eric saying he's leaning toward Linda, and Sarah toward Linda, and so on. But I feel in this case that, okay, so I learned that I have autism, that mental kind of autism, in my early 40s. And I began during that decade to see a lot of patients who had autism, that kind of autism. Not the kind where they're wordless and head banging, the kind where it's they use words like a 2-year-old or 3-year-old, literally. Okay. During that time, in a session, I literally realized that this person who was in the room he did not understand how are you, and he's going, I don't understand what that means. It had not occurred to me that there was more than one meaning. I thought how are you was a question about how I am, and if someone said to me how are you, I wouldn't say fine, how are you. I would tell them how I was, as if they were my therapist. I would just speak. I'm having a shitty day, blah, blah, blah. And I would not notice that their face was turning like, like somebody just smeared feces on their face. Like No. Okay. And I learned this in a all day seminar where I'm sitting at a table with two other therapists, and the woman running the seminar comes over and says, "So what do you do to me?" And I started telling her. She didn't give a fuck about what I did. She just wanted to know I'm a therapist. Move the fuck on. Okay. So, in some sense, greetings take many forms. What do you do as a greeting just requires 2 words or 5 words. What do you do as a question actually requires details of what you do. All of this is to say that I think Clancy and I are alike about this. If we know how that works, that there were 2 versions, it's a tremendous reduction of anxiety. It's not just knowing a single rule and following it. It is, there's leeway. There are differences. There's a kind of freedom. And I feel like when I know that "how are you" thing now, I feel like I'm 4 years old and I'm really smart. I feel like, wow, I get this. Is that at all like you, Clancy?
Yeah, but I still can't tell. Like, I still will answer it when it's a greeting. Like, I feel like I'm having an emergence when you're talking. Because I still, even at the grocery store, I'll try to like give them what I think they're asking for. Like, I
Yeah.
think they're really asking a question. I'm working on it. I'm working on it.
But the point I'm saying is, when it becomes clear, it reduces anxiety.
Oh, yeah. If I could make it clear in my mind, I would be so much less anxious. Yeah.
But it's critical that it is not just it is or is not a rule. What's critical is it's a pair of opposites.
Mhm.
And everything in emergence is knowable by a naturally occurring pair of opposites. A greeting and a question are naturally occurring things in human language.
How can you tell the difference if it's the same words? You
That
know?
and Clancy, the truth is, boy, is that a real that is the question
Because
for
I could
anyone.
contextually, like grocery store, how are you? That means just say you're fine and move on, you know?
Okay, but that contextually is inaccurate, even though it might be
Right.
likely, right? Okay. Vern, how do you know when somebody's asking you, "how are you" as a greeting or a question?
I usually answer fine initially, but then I'll look in the person's face and
Ah,
see if they want more
ah,
than just fine.
ah,
Or I'll say I'm lying if the person has time to or
ah.
wants to know what I'm saying.
Okay. So, does that make sense to you, Clancy?
Yeah, and I think I don't look. I think I'm anxious and I'm not looking. So that
And,
makes sense. Yeah.
and critically, the looking was a rule in my childhood that said, "don't stare."
Mm,
So I took that to heart as a broad brush thing. And initially, the "how are you," I couldn't tell the difference because I wouldn't look.
yeah,
And I
same.
wouldn't look because of a rule.
Yeah. Okay.
Sarah?
That's helpful. Yeah.
I was just gonna say to Clance too, like I think about it as like the context of people. Like if the person at the grocery store is like, "Hey, how are you?" I'm not gonna like divulge my life to the grocery store clerk, right? But like, if my dad comes up and is like, "Hey, how are you?" I might be like, "Oh yeah, work, blah blah blah." Like I think context of people matters.
So I think context of people is something that is, the context of people is another way to say socialization.
True. Yeah.
So, right. So if you're actually minority socialized, and so Clancy has something I don't have, which is that she got majority socialized as rules, but is really minority socialized like me, like when you left to our own devices to be right. So when you're minority socialized, rules take on a different meaning. What I mean by that is they're not just something that makes you comfortable if you learn them. Um, There's anxiety if you don't know them and somebody tells you they exist. I don't wander around like Linda and go, oh, there must be rules here. I, I'm quite against having too many rules. It makes me feel confined. Um,
Yeah, I mean, this is so extreme for me, Steve, because there was literally no rules in my childhood. There was no you put the toys here, there's no you do this, there's no you finish the plate,
okay,
there's nothing.
let me stop you, Sam, because again, yes, not no.
But when I crash into one, it's like fucking action. It's
Okay.
like,
But that's not accurate as far as the picture. Your extreme version of this comes from living in two houses.
that's right.
One is free of rules and one is excessive rules. And the
Yes.
houses were literally physically next door.
Yes, they
And you
were.
would literally go from one house to the other and back.
I would go from being a good kid to a bad kid, like in two houses.
But I want you to
Which,
see that the good kid is the kid who knows the rules, and the bad kid is the kid who knows the rules. And the other house, you're just yourself.
yeah, there's no bad kids at the other, at
Okay.
the,
Two things are in the air here, which I'm trying to do consistently. One is the idea of what Sam's literally saying, the personal piece of it. But the more important one, in some sense, is because this is a basics seminar, is that the basic quality in order to know anything in emergence in the world, this would be in physics, this would be in psychology, this would be in sociology, this would be in anything, is that you must see the naturally occurring pair of opposites. If you cannot see them, I don't say that they exist or don't exist. I simply say we can't actually take the measure of this. Because
you can't understand.
what we're then doing is we're doing Eric's 3.5 pods. We're trying to come up with some kind of artificial numeric measure that we're making up. Right. I can easily see and feel quite confident at the description between Linda and Sam and their thing about rules. And the idea that I can tip to one side or the other, like I know that Eric and Sarah fall into the Linda camp, you know, just tip. They're not the same, but they tip to that side. And I know that I tip to the side of Sam, but that I have the extra added benefit of going, wait a minute, I'm going to get blamed for something here. It's not that I'm bad, it's that I'm stupid because I like trusted the clerk to say, leave the packages here, and the motherfucker can take them all and say, we didn't get any packages. What are you talking about? Right. And then I'll then have excessive, painful thoughts of where does he live? I want to kill him. No, I don't want that. Okay. We have, this is about an hour of us doing this, this basics. And I have to say, what a wonderful hour this has been in terms of understanding what we're doing. First of all, it's wonderful that it's coming from personal experiences first. Second, it's coming from a couple people like Vern and Sarah's questions about the generalized thing, right? And the difference between Vern's question and Sarah's question are important. Vern's question is basically the topic of anxiety, which is absolutely fine. Every single map in Emergence has a topic. So tell me about anxiety would be the topic. And then Sarah's thing about, but wait, there's two kinds of situations that have anxiety in it, like the mild anxiety and this sudden onset painful anxiety. Okay, so now in that description lies everything that gets discovered in emergence. Everything is a two that are one. Sarah's two questions are the pair of opposites, which further define Vern's initial topic. And this couldn't be a better example of that's how all of the discoveries in emergence get made. If we just simply bring up a single topic, like anxiety, and then we do the conventional scientific exploration, all we're going to do is endlessly talk about examples. And what happens with that is we get a huge list of examples, all of which are anxiety, but we don't learn anything about the nature of anxiety. All we do is gather a big list. This is the diagnostic manual, where they give you a list of the symptoms, right? But they're not telling you any pairs of opposites. For instance, the oppositeness of depression and mania. Everybody's depression doesn't matter your personality in the book. Well, no matter what, you're depressed if you meet a number of these symptoms on the list. And what emergence does differently is it proceeds from the topic. The topics are probably lots of overlap in what they're interested in and what we look at, like anxiety. But the proceeding from the topic to the evidence gathering, in between that is you begin to look at examples, and then what emerges is the pair of opposites. That's what happened today between Sam and Linda. Sarah?
Sorry, I was thinking about another one like that's two that are one. When I'm looking at people and I'm trying to recognize the winces and flinches more, I can't tell what the difference is between like a person's just natural facial movement and like, is that actually a wound?
Okay. And so I want to let it go, other than I'm just going to say maybe a minute about this, and maybe then ask Sam. Let me start with you, Sam. I I'm I know that you recognize winces and flinches, and that it's a piece of your regular work. What do you use to recognize them, if anything at all, or is it more just you sense it in your body?
Yeah, it's really, I don't, yeah, it's not, I don't use any mental willpower or something like that.
No,
I
me neither.
really can't. It's confusing to I don't know what to say about it. It seems like I'm not looking, and then we're in a conversation, and then it's almost like when they wince, I suddenly see their face, see their eyes. It's like it just doesn't even. Yeah, it just. Bub, are you raising your hand, or is that are you doing this?
Sort of. I was just making connections about the
Go
rules.
ahead.
It's
Go
like
ahead.
it's the same pattern as the rules, right? Or it's like you're not really looking for it and then it appears. But I
It
wonder if that gives
appears.
you some like freedom.
Slow down, slow down.
Yeah,
That's
sorry.
no, that's really that's absolutely accurate,
That's interesting,
Like the
Bub.
Clancy.
pressure of the looking, you know?
Okay.
Yeah.
Now
Yeah,
I
I'm not sitting there following therapy rules when I'm with somebody. I wonder if that's a piece
no.
of why I can see it.
You know what, Sam? That's probably one of the reasons why you're a
But
brilliant
I have a
therapist.
lot of
Yeah.
therapists on my
Stop,
caseload
stop,
that,
stop. You're going to take that compliment like a man, or we're not
okay.
going on.
Oh, thank you. Yeah,
No, Jesus, that was a gagger. Oh, that was a
I'm not a very
statement.
good actor.
Oh my God. Okay,
Mm.
But
Clancy's
my point
saying
is,
something that's
yes.
really
I
significant.
agree. I agree. And I have stuff to back what I meant to say is that I have a bunch of therapists on my caseload. Every therapist that I see has a majority socialization, and they all report that when they're with people, they're immersed in the rules, meaning they're like,
Yeah.
"Oh, I need to ask this kind of question," or I need to say this. It's been too long since I did this. I need to look engaged. There's all manner of, but it's torture. It's not even they're not even saying that they wanna be like that. It's the terror of it not doing that is just immense, where I have nothing in my head. In fact, I go into shock, of course, if a client references a rule I should be following in some way. It rocks me, of course.
So I remember a time in my office. I don't remember. I know Clancy, you were there. Sam, you were there. Maybe Hannah, where we were talking about this, and I suddenly made a noise to demonstrate what it was like. Do you remember this, Clancy?
Was that when you and Hannah were screaming?
Yeah.
But you were
Yeah.
that was you were smashing a doll, I think, right? Or something? Is that
Oh yeah.
a
That,
different
that
memory?
was the damn it
What do you
doll.
call those? Yeah, that's right.
Maria gave me that, a damn it doll. You whatever. Damn it. Right. Anyway, every single one of your eyes winced. So
Well,
if somebody's watching the video, you will see this. Now, did I need to look at your eyes to know? I do not. I can't see Athena and Linda's. I know if they heard this, they winced. I know it. So a wince or a flinch is a bad splice in the movie of life. That's what it's like. A bad splice. Almost every horror movie uses bad splices to cause injuries in people so that they're frightened. A bad splice. Suddenly it's moving smoothly and then boom. If there's any smoothness to it, like those films where people are killing 10,000 people with guns or all this other stuff where the vampires are sucking people's necks, if it's like a massive amount of this happening, it's just like, okay, it's boring. Whatever, it's happening. Okay, yeah. But if it happens like one vampire and the person is unaware and the thing just suddenly is on the neck, you get startled. And it is this abruptness of the change in the movie of life that causes a person to wince or flinch. Now, critically, when you relive a wound, the movie is playing inside you. It's playing inside your mind and body. It's not playing outside you.
No, Clancy was literally telling me at the post office the guy was being kind, and I was in a fucking horror movie. I mean,
That's right. You were in a horror movie. That's right. But what you're saying, Sam, I know that somebody winces or flinches because my diaphragm, I'm feeling smooth. I'm not really paying any special attention. It's definitely not, I'm looking for it. And I can immediately feel when somebody else, even one person here, has a wince or flinch because my diaphragm contracts. And I'm judging it by my body more than anything that I'm seeing. I can see it sometimes. Before I saw Sarah do it, before the word uncomfortable about the person, it was very clear. Um, but often it happens and I'm not even looking in the person's direction and I know it just happened because I just felt a bad splice in the movie. It's a feeling, physical feeling. But then again, this is like anything else. Like, how do you determine how much detergent to put in the washing machine? Well, you look at how the clothes come out, and over time you make up your own freaking mind. You know. All right. So, the two kinds of anxiety. The kind you're having, Sarah, the first kind where you're saying you're still adjusting to the new place, and you have mild anxiety because you're looking to observe the rules that you haven't seen yet. As opposed to Sam, who doesn't even realize there are rules in that situation and is startled when a rule emerges. But no surprise that Sam and I are minority socialized, and so as therapists, we don't run by rules. I don't mean there are no rules. I mean I don't use them to talk to people. I just am.
Can I give when as therapists you have to write like your note and you need to include like what did the therapist do? And it's hard to put into words the interventions because I'm just doing I'm just being, right? Like so it's
Sarah, over time, you'll learn to fake it because
like
most of what you write is fake. Look at Vern's face. Do you realize how many people Vern has had to clue into fucking writing a note and get with the program? It's not about something really helpful. It's about the fucking insurance. We have to earn money or else you have no money. Right. Look at her face. And I mean it literally have to be dozens of people that Vern has had to have this talk with. And it's not easy, Because what you're asked to do on the one hand is you're asked to be thoroughly genuine with the human being, and then you're asked to be thoroughly fake with the note. And I want you to see how I am making it make sense to you, Sarah. I used the pair of opposites. This is how we know the difference between being a therapist and a therapist writing a note. It's literally that. Look, and if you use a simple practice or some kind of a software for this, they have a drop-down list of fake things to say. And you just pick from the menu of the fake things. And what else? You're not going to tell them something from Emergence because what are you going to do? Say, I did a paradoxical intervention? Or describe that? No, you're not going to do that. Because, the retarded clerk who is going to judge you as a human being has no idea what those things mean. They've never sat with a human being. It might not even be a person. It might be an AI.
Sometimes I don't even remember what I do because, like, I've heard Sam just say like he just is blank, right? Like he's just so like not blank, but like he's so invested.
Sarah, genuine with the client, fake with the note. The problem is you're trying to use memory with the note. You don't remember fake things. You make it up. It's fake. There's no memory necessary.
I need
You
like a
make
drop
it up.
fake things I can use.
Do you know how
Yeah,
many
like
times?
you ever read Aesop's fables or you know
No.
Mother Goose?
Yeah.
She knows them. She just doesn't know Aesop.
Mm.
Oh God, Grimm's.
Oh, look at Linda, motivational interviewing. There you go.
There you go.
There you go.
Oh, that's
Motivational
every
interviewing.
note. This clinician used MI to explore client's
Right.
ambivalence.
This clinician used Mission Impossible to explore. Right.
Yeah,
No.
all Sarah, I pretty much every client is CBT thinking errors,
Yep, cognitive restructuring,
cognitive
Crap,
restructuring.
Socratic
crappy bullshit
questioning.
therapy. Yes, that's right.
Let's hope the insurance companies aren't
Yes,
watching.
psychoeducation. That's a good one. I do that a lot.
Oh yeah, psychoeducation. Every session.
Love it.
Okay.
Love
It's
it.
all
But
psychoeducation.
let's go back. All these things said, let's go back to what just happened when Sarah asked the question and what I'm trying to make obvious, explicit, is the idea that when you're sitting in a therapy session, what really guides the session comes from the person. And they're raising the topic. They're doing the Vern, what about anxiety, right? Or you hear it, you kind of like hear it in their sentences, and they're raising the topic. And then you, on hearing some of the examples or a little bit of what they're saying, you divide what they're saying into the pair of opposites, which then organizes the whole session. Eric?
Yeah, I had like this awesome session yesterday morning, and it was because of this specific thing that you're raising. And, I'm not going to reveal too much information, but they talked about like these two people that they had dated in the last 2 years. And, there was this very obvious pair of opposites where there's like a lot of volatility in one and a lot of stability in the other. And just looking at
Ah.
but like the stability was boring, but the volatility is like I don't know where I stand. So it was like this very clear pair of opposites, and that is exactly what happened. Like that became the session. Like, where do you even sit in that? Like,
Okay. So now, Sam, I want you to turn that into a pair of opposites functionally.
The pair of opposites of the
Yeah,
volatile versus the
I don't
stable.
remember who said. Operationalize what Eric just said.
I don't know what you mean. I'm
Okay,
not sure what you're
watch.
asking.
I'll give an example, okay? All right. So, operationalize. First of all, to operationalize an intervention, it must be visual. Period. No exceptions. Visual means it has colors. whether the colors are in the room or whether the colors are in the internal worldview, colors. So operationalize what Eric just said. Okay. I go, after a while listening to the client, I then go, this raises an obvious question. You have these two people, a pair of opposites, stable and volatile. And so, of course, the question is, in somebody's head, which one of these kinds of relationships do you really want? We've talked about the stable one can be boring, and we've talked about the volatile one being really unpleasant. Okay, but I think it's not that simple. So let's consider that you're at an amusement park, and this is the world's greatest roller coaster, extreme. There have been known to be near heart attacks on this, right? And the grounds around this, there's beautiful flowers and restaurants and music playing, blah, blah, blah. Okay. So now, in some way, I could say, which one would you rather stay in? Would you rather stay on the ground and never go on the ride? Or would you rather stay on the ride and never go on the ground? And now it begins to operationalize for the person, because when I make it that, it isn't so obvious to pick one. And then what does that do? It opens up the discussion of the two relationships in a way that the person has a chance to learn for themselves. Instead of making it one or the other, which is not a pair. That's just two separate ideas. But to make it a pair, they both have to have, and this is the idea, if it's a real pair, they both have to have an upside and a down.
Yeah, Steve, when you started explaining it and I understood what you were asking for, I think I'd almost take the client, each relationship, and have them draw a picture of the most intense moment and just the flat and just the most relaxed with each relationship, like a
Excellent.
drawing, four drawings.
Okay, and so now look at now what Sam just did. He just operationalized the intervention in his own way. And truthfully, if you're thinking of any kind of memorization, forget it, because this has to happen in the room with the person in real time, and there isn't a right or wrong, and you don't have to have the whole thing yourself. You develop this with the client. The two of you together co-create this thing. What we're adding is the idea of that, how do you operationalize something using emergence? And it is, first it's visual, it has colors, and the second thing is it is a pair of naturally occurring opposites. Right. The roller coaster is not naturally occurring, it's man-made, but the experience on it versus the experience of being on the ground, those are naturally occurring opposites.
Steve, when you say colors, making visual has colors, tell me more about that.
Okay, good. So when I'm saying this
question.
thing, that's excellent.
Yeah.
Hope you're taking that in, Vern. There you go. If I was to do this, and I would give that example, the first thing that I would do is I want you to imagine that one of those bench seats at the roller coaster. What color is the bench? Red. Okay. There's a bar that's coming down, or a safety thing that's coming in front of you. What does it look like? What color is it? Okay. Now, when you do that, the next step, which is it's already been operationalized. We have created an operation that we're going to move forward with in the session. But now what we're doing is we are personalizing it. We are making that thing that we've created, the operation, actively visual in the person's mind by asking them to picture the colors. Sam, I'm sure you do this automatically. It's just, and as you've been saying, I don't think about doing this. I have never, before 20 minutes ago, said these words. I have never said the idea of operationalizing it. None of what I have said. This is simply me kind of summarizing things that, based on, Sarah's feelings of having to learn the rules, or what Sam is saying about he doesn't have them in sessions and so on.
Yeah, like what Vern is asking about, if you want to talk about basic, I mean, it is like so fundamental. I mean, one of the elevator speeches, like I even have it in my Psych Today profile, like helping the client explore what they can and can't see, or some emergence sort of tagline. But
Hmm.
like that's literally when you say what someone can and can't see, it literally really means shapes, colors, lines. Of course, the shapes, colors, lines have like descriptions, like a bird, a frying pan, or whatever. But like, yeah, literally, like if you're not doing the colors, you're not gonna find out what they can't see. Like if they're like, I can't, for some reason, I can't see the bar, or I can't see the thing, or I can't see the
Ah,
color, or like
ah.
I feel angry when I'm seeing the color red. It's like, but you can only do that if you ask for color, shapes, and lines.
So let me slow
Um,
this down, because what just Sam just did, without making it explicit, is he went to the next step. And I'll come back, Sam, because it's just so
mm,
automatic for you that it isn't a separate. It's not the, and I'm separating it out today. I've never done this before in trying to come up with what is it that we do, So when you said bird, okay, if you say bird to somebody but you don't ask them what color the bird is, you're not picturing it.
no,
I pictured first a blue jay, and then I pictured a bluish parakeet in a cage. So, but this is almost automatic for me in order to understand things. I picture as I go along. It's not a rule, and I don't do it every second, but I do that. And if I'm picturing and the other person is not picturing, my body feels an emptiness in it. But if I'm picturing and somebody else is also picturing, regardless of the differences between the pictures, I feel a solidness in my body. I feel a connection with the person. So a lot of what I'm reading is in my body. But it's more than intuitive if I can put it into words. It may start as intuition, but, you know. So what you said, Sam, you said, talking about the color, shapes, and lines,
mhm.
and then you said what you do with that information. You divide that information into two, a pair of opposites.
The color, shapes, and lines they can see, and the color, shapes, and lines they
Yes,
can't see. Right,
Sam.
right.
Yes, so now we've operationalized it. We've created the starting point. We have a topic from the client. We've operationalized it with a pair of opposites we're looking into, right? Like,
And just their reactions to the pictures too. Like,
of
I
course,
fucking hate that house.
oh,
Something like
of
that.
course. But before you go there, that then skipped another step ahead. So you're operationalized, then you personalize by getting them to have the colors for the pieces of things, right? You personalize. But then what you do is you do the therapist's step. Normal people don't do this. Most therapists don't do this, which is, what are the things they can picture and what have colors, and what are the things they can't picture. And so what we have now divided up is, all the material they can picture is not the problem. The things they can't picture are the problem. Clancy?
Yeah, I was just gonna go back to that example of Sam at the post office because when I told him, can you see he was trying to be helpful, Sam couldn't see that and he kind of went blank. Um,
All I have in that scene is the words the guy said. I can't see his face when he said the words. I can't even hear his tone of voice. All I can just hear is like the words as if they're written on a paper. Like, you can put the fucking thing. If you get here, if you don't want to, you can put the stuff on an empty desk. That's all I heard.
Okay, slowly. Everybody look at the oppositeness between Clancy and Sam. So let me investigate a little more. Clancy, what things can you recall from what happened? Like see or hear or feel?
I just remember liking the guy like immediately when I walked in. I liked the two workers a lot, and I remember one of them had tattoos. I remember the other guy's mustache, and just he had like a gentle vibe, like immediately, even before I talked to him. Um, and I remember him saying that and knowing previously that I felt he was gentle and just knowing it was just a gentle statement. It wasn't like he had a need. It was like just a really casual, like trying to make it easy for him. There's no edge at all.
I also think about, I just saw another pair of opposites, which is I'm directly interacting with the person, but
Yeah,
Clancy's watching the interaction. So it's
right.
a different level of, I don't know,
You're
pressure or something.
okay. That comes back to Vern's anxiety piece or Sarah's anxiety. In other words, your anxiety is higher about this in part because you were not taking in the information Clancy was taking in. And I'm not saying you should have. I am not
Mm-mm.
saying you could
No, I
have.
don't feel
I'm just simply saying without that information, Sam, the rule comes like a voice of God. It
it.
doesn't come from a person.
Yeah, it definitely didn't come from a person.
And for Clancy, the rule came from a person that she had already had a sense of.
Yeah. I also remember when I tried to tell Sam in this session, um, the guy's reaction to him, like how I felt that emptiness of Sam not picturing.
Yes, yes, yes.
Yeah. And
That's right.
I almost felt blank, like I felt like
Yes.
a stopping point in our connection. Yeah.
If I, that's perfect, Clancy. If I am having somebody picture, that sets the basis for what I feel like between us. If we can both picture something, it doesn't matter the differences. If we can both picture the topic, right? If somebody pictures a crow and the other person pictures a sparrow, okay, but the crow is black and the sparrow is brownish and white and blah, blah, blah. Okay, if you can picture those two things, I can't put them in the same scene. I just tried. But I can go from whatever, the crow to the sparrow, whatever. I can picture both those things. Okay. If am doing this with another person, there's a smoothness, there's a decrease in my anxiety when both people are picturing. There's a decrease, there's a calmness, a smoothness, an ease. Okay. At a point where the client loses the picture, I feel the collapsing connection between me and the other person, like a field is collapsing, a magnetic field or connection. And when that happens, my mind goes blank. Just what Clancy just described. Absolutely.
Yeah. I think I flipped upside down too, and I felt like I did something wrong. Like, yeah,
Ah,
like I went
boy,
too far, I did too much. Like, yeah.
well, boy, will that bias you um, in such a way that you'll now be more worried about doing it right than you will about what's happening between you and the client.
Yeah, that's true.
I it's not that I would never feel that. It
Mhm.
would depend on how abrupt it was. But generally, when I feel that, it's simply me being guided by my own body and intuition and a lot of things where it's happening inside me. It's not, I can't see the thing that's happening out there necessarily, but I know that when somebody's picturing and then they stop picturing, I feel the thing collapsing, the connection
Yeah, I
collapses.
felt that first. Yeah, and then the
Yes,
flip.
that's
Yeah.
right. And then
Mhm.
you then go to what did I do wrong?
Yeah, whose fault? Yeah, my fault. Yeah.
Which, coming back to where we started earlier in this, you flip upside down. And
hmm
then you feel urgency, anxiety.
Um, yeah, I think I didn't feel like to do anything, but I felt like oh no, like an urgent oh no feeling, like how do
That,
I fix this?
that,
Yeah.
and that's just the urge.
Yeah.
Without the behavior, that's really solid. That's just the urge.
hmm
And you can tell you flipped upside down because of the urgency.
Hmm.
Sarah?
I'm thinking of two clients, that the best way to describe it is like they're so outer layer that like I don't think that they're picturing anything, and I'm realizing that those are making those clients are making me most anxious because like I don't know how to connect to them in those moments, and then I
Ah.
feel a sense of urgency to be like, I don't know what to do, like I don't know what
Okay,
to
stop.
ask.
The first thing to do, Sarah, is to recognize that if you flip upside down and you feel compelled to fix it, you will not. You will cease to be a therapist in those moments. You are a drowning child who's afraid of whatever's happening in the room. So it isn't that you're a bad therapist. I did not say that. You cease to be a therapist because the urgency causes you to be so focused on what do I do next, or what did I do wrong, or this feels terrible, or what just happened. And you are saying, in some sense, in a layer two way, that the person is in layer two. Okay, so layer two means no picture. Words without a picture. The four outer layers, all four of them are words without a picture. That's what it means. The inner layers are the four layers, well, not layer eight, but the places where you can picture. 10, 9, and 7, you can picture. 1, 2, 3, and 4, no picture, but words. 7, you can picture without words. You can feel urgency without words. So you can know you flipped because the first piece of the urgency, the first piece of the anxiety, will be anxiety without words.
Yeah,
That's,
and
that's
like
layer 7.
it was the way Clance, like it was how you described it, like you allowed me to like see that connection and that correlation. um I guess the next question is like, how do you get somebody to picture if they're so like layer two?
Okay, so first of all, you're 3.
Yeah.
You're asking how you can give to them.
Yeah.
Okay, good, good, good. And I know you do this, Vern. I know you do it too. If you completely flipped, you're going to focus on what you can give the other person, and you will not be in your normal state of mind where you can just where your intelligence is accessible and you take your time and you think about what you want to do next. Sometimes the best thing is to just sit with the client and not say a word.
I feel so uncomfortable. So uncomfortable.
But you're uncomfortable because you're upside down. You feel urgent needs to give to the client, and you're not yourself.
Interesting for me, I have that less as a therapist and all the time interpersonally in intimate relationships.
That, you know what, Vern?
Wow.
Boy, okay, now we're looking at a pair of opposites here. So, in my very general descriptions to people about their lives, I often break their lives into their out in the world life and their at home life. And those are many times a person has one solid and the other one not. In really severe cases, both of them are like rocked, you know. But the thing you're saying, Vern, this becomes one of the most confusing things that a person could ever experience because they go, who am I? How can I be
Yeah,
this to
Vern, I have
you?
like no pictures of you like the stuff Clancy's saying about I feel so, but you're so like you're like the least codependent at work. Like I would be crashed out with some client and you'd be like call them and be like, you're lying, you know? You know what I mean? And just be like, you can't come back. Goodbye. You know, to be like, wait, what? But yeah, but it's a trip how that it could be like that, you know?
But this, Vern, of all the things that you could get from today, and I know that
Yeah.
you're getting a lot because I'm watching you like holy shit, and you need to hear The words that are coming out of this are being co-created by all of you with me. I have not described emergence therapy in this way ever, not in this sequence of events. Okay, but of all the things to take away, that single thing about your out in the world versus your at home life is the most critical of all. Because if you are significantly different in the two worlds, then you will experience kinds of ambivalence in both of those places at times because you'll be confused. Sarah, when you're talking about flipping upside down like that, you're talking about, things where you're reliving shit with your dad. I'm not saying that only, okay? You're reliving things that are more at home. So now you cease to be a therapist in some sense because now you're a daughter or you're or whatever. Like you're in, what's that?
Or even like a friend, like trying to find
Or
like
even a friend. That's correct.
out, like
That's right. You're not in your profession. You're at home. Eric?
Do you think there's a relationship between not picturing and not being in the scene in
Oh,
the way it
100%.
affects us?
Literally, it's literally true. But even more than that, okay, Eric is raising a new topic. And when I'm saying it's a topic, it doesn't mean it doesn't have Vern's anxiety topic. But Eric is raising something that's huge. Would you say it again, Eric?
I said it. Do you think there's a relationship between not picturing and not being in the scene?
Okay. You cannot be in a scene if you're not picturing. But
Mm.
that's just the simple statement of the description. What's more important is that the majority of what occurs in all therapies, even ours, the majority of what occurs with words. It's talk therapy. So the potent parts of what we do is we use words to get people to picture. That's the potent part. That's the piece which is a deliberate act, which is opposite traditional talk therapies where words are words. And the logic is where the value comes from, or the understanding of the words.
Insight.
Right. But insight literally means sight. You don't have an insight from words alone. You may have an in dictionary, but you don't have an insight.
Yeah, I brought this up because like our topic today touched on like 20 things that happened in this one experience that I had this week,
Okay?
where there's the rules, there's the scene, there's the anxiety, there's all of those things.
Yes.
It's not a long story. I went to pick my dog up at the vet, and usually they give you the dog, then you pay, but my dog is very excitable.
Okay. Pause.
And yeah,
Pause. Usually they give you the dog and then you pay is the socialized rule. This is what you
correct.
expect. Right. Good. Okay.
Correct. And my wife even told me, I don't think they'll let you do the opposite.
Okay. So that
But I went,
reinforced the rule. So in the
yeah.
call said, and this rule is a sure thing.
And
Okay.
I asked, I said, but I'm special, so I'm gonna ask.
No, wait. You're a three and you were right side up, so you fucking spoke up the way a three speaks up. Okay.
So I asked, and everybody's just kind of like, what? Wait, what? And it threw them all off. They were just
Stop.
like,
Stop. So there were a number of Sams there who each had their own MR who lived next door, some version, right? Okay. So,
so they're like, okay. So then I go around to the pay thing, and then the woman comes, she's like, I'm here to take you to see your dog and get your dog. And I said, well, I want to pay first. So she looks at me like, oh, okay, I'll come back. I'll come back. So now I interpret she's mad at me. because
Okay,
I'm
stop, stop,
breaking
stop,
the
stop,
rule.
stop, stop, stop. There you go. Now you interpret that she's mad at you. Did you
Yeah.
ask?
No, I have no idea.
Okay.
And then the woman at the counter, this is the even better part. My wife is having an argument about a previous bill. So I'm trying to pay the current bill. She's trying to ask me about the previous bill. And then all of a sudden, I'm just like, it's becoming like this whole thing, right? And then the lady comes back, who's supposed to bring me back, and she's just got her arms folded and she's just standing there waiting for me and waiting for me. And
Wait. Pause. Did everybody see Eric flip? Eric went into the goose state.
I started apologizing to her. I asked
Like I
her,
said, I mean now, in this here and now, as you told the story, you flipped, Eric. Right now,
I
you're in the
felt
you
it.
state.
I felt it.
It's interesting, Eric. It sounds like the body posture made you flip. Like the body position is what tipped you.
Hmm.
Because you really you zoomed in on the weight on this piece.
Okay,
Yeah.
Sam, let me caution you. It can also be that
I
Eric.
said seems. I said seems like that, but all right.
No. I didn't miss that part. I got
Okay,
you.
okay.
Yeah, right. There are certain person that you and I both interact with who would kill us for not saying seems, but whatever. So, Eric, you could have felt something that wasn't visual yet, and then the picture that came to you was like this, and then the person actually was like this. I'm just trying to say the complexity, Sam. That's all I'm saying, right? No, I'm not saying what you said is true. Anyway,
And
It's
so,
very it's so
and the story's almost over. So then the woman who's doing the billing is like, okay, well, I have to make all these calls and find all this stuff out. So why don't you just go and get the dog and I'll maybe have an answer for you. So after all of that
that
stuff,
was very clever.
I became so
No,
dysregulated.
wait, you missed something. I think Vern
What was
said.
clever?
Okay, the woman got you to follow the rule. You got the dog before you paid.
I know.
No, no,
I know
you
now.
know
I know
now.
now.
That's
I know
right. You
now.
know now.
I see it now.
Right. And look at the threeness. Look at
Why
him. The threeness is going, that fucking bitch.
I don't understand why it's such a big rule. Like, why wouldn't
Okay,
you?
Sarah, don't, no.
But
Unnecessary. Don't go.
the part that really fucked me up about the whole thing though was then like I go in to get the dog and I can't even sit with the doctor. I'm like apologizing to the doctor and I'm saying I'm so sorry. I can't even hear you. Like I feel like I'm not here right now. Like there's this bill thing with my wife and they're arguing and then he's like, "What's going on? What's going on?" And I'm like, "Oh, I can't even explain it. It's too." And I basically just grabbed the dog and just got the fuck out of there.
Okay. You were upside down, which means that you have to give. You gave to the dog. This is really a big deal in seeing this, Eric. We are talking literally about how to see yourself flip upside down and, regressing that back to where it came from. To Sarah's question, or Clancy about if you're upside down, are you always regressed? Is that anxiety? Is that the source? Like there's so many pieces in the air here, but you being able to recognize when you flip is incredibly important when you're a therapist. Not just in your outside, home life, but as a therapist, this is critical because if you flip upside down, you or Sarah or Clancy or Vern, then you're going to lose yourself. And in losing yourself, you're going to immediately fall into that assessment crap of I'm not a good therapist. That shit has lasting effects on people. And I know you know better, Vern, so because of your long experience. But in those moments, if it's extreme enough when you flip, you feel as if I have no business being a therapist. And quite honestly, in that moment, you don't. In the moment. In
Yeah,
the moment.
my thing is I'm not a good wife.
So in the moment, okay, got you. So in the moment, you don't belong being a wife. Got you. And so this is so critical because we all people can flip, even ones. They can go from normal to T-Rexes on a dime. So holy shit. Okay. But the flipping, all right. So something we have not gotten to, but it is being raised by this is, so when you are a therapist and you flip, like Sarah raised this thing about she didn't know where to go, the person's in layer two and she doesn't know where to go, and she's flipped. She is compelled to figure out, how do I give to this person? How do I help this person? But with the urgency, right? And Eric, when you're flipping in the dog place, in whatever about Nicole having a fight, okay, setting aside any of the particulars about injury or early childhood or this or that, when you flip, it's like a tidal wave hitting the other person that you're with. So when you flip, often you flip the other person. Remember, everything in emergence personality theory is relational. It is the interaction of people. It's not some person in isolation. So when you flip, this then comes like a bigger than normal wave and can knock down the other person until they're also flipped. And now the both of you are children. The both of you are regressed. The both of you are not like doing your best or acting as adults or able to think clearly. And the shit hits the fan. Clancy?
Yeah, that makes sense. Like as a three, if I flip, I'll be urgent you. And if I'm with a one and they flip, they'll be urgent me. And then me giving will create more need in them.
That's correct.
Yeah, you just go on forever, just needing.
If you're with a one and you flip, so you're in an urgent need to give, that to them is like heroin to a heroin addict.
Yeah, yeah,
And that causes the one to flip, and they're on like, feed me, feed me, feed me, give me, give me,
yeah,
give me, give me, give me, right? And then you, being urgent, you're going, yes, 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 okay, yes, 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 I'm doing it, yes, yes, yes. And they're going, yeah, 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 keep going, yeah, 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 yeah. Holy shit.
yeah.
Right. But now this description at home, okay, so let's say that you get mad at Sam for something.
Me?
Yes, you. No,
Okay.
not somebody
I
else.
was like,
You.
burned?
I
That'll
don't
be
think
fun.
it's, okay, could be the same. I don't think it's remotely. Okay. But let's just say that you're annoyed at Sam because he left food out on the counter that should go in the refrigerator. Now, let's say that you're not having a great day and you text him and say, but what would you say
I
in a
would send a
text?
picture.
You would take a picture. Oh, look at this.
I'm like, make it visual.
You would take a picture of the dish on the counter. Okay. Now, and then you would send that to him in a
Yeah,
text.
I would say something snarky. I would text something snarky with a picture. Yeah.
Snarky plus the picture.
Yeah.
Okay, I got you. Sam, upon receiving said snarky comment and picture, what do you imagine happening to you? What kind of reaction?
I mean, it's the post office
Rule
thing.
that
It's
doesn't
like
exist.
a
Yeah.
rule that I'm going into shock
Ah,
because yeah,
ah,
no,
I see. So it's the post office rule. You didn't see it coming.
right.
Okay.
I'm never like, oh yeah, I knew that I did that. It's always a surprise. It's always an unpleasant surprise.
Okay. Here's something to take into account. Um, Without actually asking, I am going to guess that said left out on the counter item and the snarky comment has happened and been sent to you infinity times, Google times before, and in some way that seems miraculous or deliberate, I didn't say, you haven't realized there is a rule yet.
Yeah.
I've not changed still.
Yeah.
After 13 years of those photos, I should really make an album, a photo
No, no,
album
no,
of
no.
those.
Sam, that's not the solution.
No, I'm joking, of course.
No, no,
Yeah,
but you're half joking and half
there's no
not. No,
solution.
there's no solution that's like that. The solution is for you to recognize that your anxiety is so high in the times where you don't know that
Yeah.
there's a rule that you don't actually internalize the rule in a way that makes sense.
Yeah. Yeah, and I'm just like
Yeah.
Mary Rose, like I'm not being kind about it, you know, and I wonder how that affects him too.
Are you hearing that, Sam?
Yes. Well, I was thinking in my head, even if
No,
she
no, no.
was kind, I'm not sure I'd notice.
Okay, but you see what you just did is the same thing as the post office. You didn't notice the guy
Yeah.
in the post office was kind,
Mhm.
and you didn't notice Clancy was just kind. She said that
Yeah,
with
yeah,
such a soft kindness. And so now what we're talking about is the situation perpetuates in some part on
yeah.
your
Nothing. I don't learn
Yeah,
anything. Yeah,
you
exactly.
don't that's the thing and the not learning, that's the thing.
I
That's so
don't learn,
smart.
and I haven't learned.
And I want you to see there's nobody is saying any fault. This is simply descriptive. Like this is one of the elements that is necessary to call the thing emergence, is that it's descriptive, it's observation. We're not inferring, we're
Yeah,
not
this
doing
this
any.
is arguably the most worldview. This is one of the biggest worldview challenging cross sections. Like if I'm in a couples therapy session and I take a
Hmm.
couple to this particular moment, it's such a challenge to what exists, the previous interpretation of these kinds of events. They don't care, they don't give a shit. And to challenge that is some of the worst those are some of the worst moments in therapy for me, is because it's like you're asking someone to give up their entire worldview of blame. It's really it's intense.
Okay,
Like I can appreciate. My point is, I appreciate that moment that just happened because this is not normal. The way me and Clancy just reacted to that is not normal. Like it's not. We're not having a meltdown. And Clancy's not going, well, but I just think he doesn't give a. It's like it's not like that.
but
I
but
think
but
I've been through that before I knew Emergence. That's
Yeah, I have
logical,
empathy for those
you
reactions
know.
for sure.
but I
Yeah.
think even when the two of you are having that happen, still, a little while later, the both of you will have some sense of what just got discussed. It's just simply this just happened in real time.
Yeah.
And to see what's missing, which was the point we were in the therapeutic process, right? The topic,
Yeah.
the pair of opposites, operationalize, right? The picture the things with color, the personalize. And now we're to the point of what can't be pictured, which I don't have a name. It's just simply, non-visual. Something non-visual becomes apparent. And the non-visual in the post office and in this thing I just made up is the kindness of the other person.
Hmm. Yeah.
So, can I ask you, Sam, going to the house next door, can
Mm.
you ever picture her being kind to you?
Not in that house. No, I have an event, but it's not in that house.
Okay, so I'm just simply going to leave you with that's the place that you could make the greatest gains with this thing about you and Clancy.
Yeah, I had that ambivalence in the first hour. I was like, I wonder if any of the time she was saying the rules. There was times she was obviously pissed off, but there may have been times where she was telling me a rule and it was just kind. Like it's not, she wasn't like yeah, again, like I can picture times where she was kind to me that are clear as day, you know.
But this is critical because um, if you and okay, so the way that Sam is saying it, everybody realize that the way Sam is saying it, he's merging the things that he could have seen, inference, not observation, and the times he can see it. And the focus should be only on the times you can't see it. If
Mhm.
you put in all the times you can see it, the whole thing gets blurred. It's not focusing on where the problem is.
Yeah.
It's suddenly subsuming all the observations into one big mess.
Yeah, what I'm not doing a thing where it's like, oh, it maybe those times exist, like some positive bullshit. I'm literally saying that because Clancy was there, I'm literally saying, here's an event where
Yes,
I literally could not see, and then
yes.
I'm going, it's connected to the now I have to go back and consider if I can't see it now, I probably couldn't see it then.
Okay, this is what I'm
And
trying to caution
yeah.
you on because you see, all right, how do
But
I?
my point is that I'm just to say it succinctly. I what I can see not is that she was kind or something. I can just see that I can't see shit.
Okay,
I
what I'm
can see that I can't see that.
okay, and this is what I am trying to do because this may be the biggest. You can do all of these things well, and if you hit the point where the thing that's happening now happens, you get bogged down in details, and the likelihood of having an aha decreases dramatically. Why? Okay, I'm going to do the pair of opposites here, and the pair of opposites is a literal scene that you can picture, a generalization of all the scenes, the kind of scenes you can picture. If you move to that second piece, you've moved away from what you can heal. You cannot heal a generalization. It has no colors. You can only heal a specific thing, and it is unnecessary to have more than one example of the specific picture. That's all you need to heal. That is it. A specific time where there's evidence, clear evidence, that the person was kind, but you can't see it. One scene. And if you focus only on the one scene, you now have up the odds the person's going to have an emergence. The minute you take it to a category, you have now diluted the entire process to the point where there's not a lot of oomph. And the category is true. If, for instance, it's at the end of a session and you've come to the point where you want a memorable thing to start to go to in the next session, okay, I can see we need to work on category next session. But then the next session needs to be operationalized, personalized, and then look for what can and can't be pictured again. But the entire point of the change, a change in a person's personality, a permanent change, can only happen in a single scene. Then that single scene is the seed for the change in the pattern in the person's life. But if you generalize from a scene to a category, you're going backwards. You're diluting the process to the point where now you have to work your ass off to try and get the person back to a scene. And truthfully, generalizing feels less painful. So even therapists and clients alike, when that happens, there's a relief. There's less
Yeah,
anxiety. There's
it's
less
so much number.
it,
Yeah, it's like why
yes,
people
then.
say I hate
Yes,
men rather than zooming on the specific man that they hate.
that's
It's so
right.
much less painful to just go out to a category.
That's right. And even this man that I hate is a category as opposed to the time when he said to me, blah.
Right, right. The literal painful event that he did.
Mm.
Yeah.
Now, if this is too broad to actually follow other than the gist, I know all of you are getting the gist, but if it's too broad to follow, realize all of the pieces before this, all of you seemed to be able to follow fairly well. Whether you remember them in a way that they're just internalized yet, that's irrelevant. You have this video, you can watch it as many times as you want. It's been pretty clearly defined as we've stepped through this. This point where you have the picture or you have the thing identified that you can't picture, and you can picture some exceptions, which I haven't named that as another step, but it is another step. When you're dividing what you can and can't picture, you are in effect dividing it into, well, within this kind of a scene, things left on a counter, for instance, or texts that somebody is mad at you in. Can you picture, whatever, the phone where you are, the person, or can't you? And then the focus should be on the times that you can't. If you go back to the times you can, you get lost. And if you go to the times you can't and then you layer to it, you make it a category. Oh, look, it's all the times where I got the text where I am in my office. Instead of the one time and just digging into that one time. This is the biggest error that people make, and the reason for it is because it hurts less. To go to the generalization decreases the anxiety. So this is, in some sense, coming full circle from Vern's question 2 hours ago. So how do we reduce anxiety? Well, one of the main ways is we go to the outer layers, and layer 2 especially. We talk about the category. We logically arrange the shit. We see how it fits into the dictionary sense of things. Why are you laughing, Sarah? Athena? Oh,
Kitty cat.
I
Kitty.
see.
I couldn't get my mouse. Yeah.
Okay.
Like, and then the cat was like,
Eric and then Clancy.
Yeah, I mean, and also I felt like the generalization keeps you from having to like exist. Like for me to generalize, I don't actually have to like have a real opinion, like a real
You don't have to have the real human experience.
yeah, yeah.
In other words, think about domestic fights. I don't mean violence, I mean just fights. You have a fight, and you go through the thing, and you're talking. I hate processing because the word for me means go move into layer 2, use a lot of words about it. You get so fucking numb you think that you made some headway. You didn't make any headway at all. You got numb.
Hmm.
That's
Yeah.
Yeah.
processing, right? And an awful lot of talk therapy, CBT for instance, is processing. Why? Well, the person feels better. They leave. I feel better. Well, why do they feel better? Because they feel less. Not because anything changed. They feel less. And it's
And
because it's
and
been generalized and it's removed, it's depersonalized, move far away.
the other thing too, this thing kept popping in my head about Sam and an oppositeness with me and Sam in like the picturing realm that I felt was like really important. Which, Tom tells this story about Sam always bumping into these flags like in his house that they're like they hang a little low and he never sees that they're there, right? But like his ability to move through pictures like with clients, within himself, like
Mm,
within others, is
mm,
like skyrocketed.
mm-hmm,
And I feel like I'm the opposite. I feel like I won't hit my head on the flags. Like I can see, like I could talk about all your backgrounds. I could tell you what my wife was wearing yesterday. I have tons and tons of data about what's happening. Even like now, I can picture a client I sat with on Thursday, what they were wearing, the way they move their face, the way they move their. I can see all of it,
mm-hmm,
but I wouldn't go there. Like I could be there in the moment and see it all.
mm-hmm.
But the thing you're talking about right now with the picturing is probably the thing that's fucked me up the most about emergence.
Okay. So, okay, I want to hear tell me what it is that you're saying has fucked you up the most about emergence.
Is that I feel like this is not natural for me to even picture
Okay, pause.
that I hear things
Okay,
and feel them.
Eric is raising a topic. I feel like it's not natural for me to picture. Okay, this is a typical topic that you could experience with a therapy client. You're not a therapy client right now. We're all learning. So this is not the point. Okay. So then the first thing is to operationalize this. Meaning what? What's the pair of opposites? Well, the immediate pair of opposites Eric has raised is him and Sam, right? And it literally did that really well. But he's saying about himself, he can picture easily the client's clothing from last week and he would not bump into whatever the things, on his head. But what is it that you can't picture? What category, what kind, what's the oppositeness in sessions when it's happening in real time, picturing with the client. Can everybody see the blankness in Eric?
Mm-hmm.
All right, so this is Eric's body answered the question. And Eric, can you picture what a client was wearing last week? Any client? Pick a client.
Mm-hmm.
What color?
She has white t-shirt on.
Stop. Okay, can everybody see the effortlessness with which Eric did that? Effortless and effortful are a pair of opposites in emergence. So the effort that Eric was making to try to picture the things that he has trouble picturing, okay, that Sam can do effortlessly in a session. I'm going to tell you that this is a good example of scene story. Eric, you can see the details in a scene, but Sam can do the story thing like a whiz, like a wizard. So he has this visual ability to see the story, and you have the visual ability to see the white top. And the difference is what? The scene is the experience. You can experience what the woman was wearing, not just recall it. You can picture it.
Mm.
Picturing is the origin of the experience. Picturing. But Sam can picture the experience. It's not the experience. The meaning of the story, how the pieces go together, and what that means. This is an oppositeness in the two of you by nature, which does not mean that you cannot learn to at least have some of the skill of the other. It does not. It's just simply there's your first way of processing.
Yeah,
Look,
man, I can't picture fucking. I mean, the outfit. I'm trying to do the outfits. It's like no shot, no shot on the outfits. Maybe something, but it's like really extreme outfits that are standing out in some way. Like something very extreme is all I can picture.
hmm, wow,
Even yesterday, I saw 9 people. I'm like, they could have been naked for all I know. I can't picture shit.
wow. So I can picture sitting next to Linda last night, and she had on jeans, light blue jeans, and she had on a top that had some oranges and whites and some other colors in it. Um, yeah, I mean, I can do the thing you're saying, Eric, but my first way of my first urge was to preface everything I just said with the story of where I was and how I got there. And I chose not to do it. And this has taken me like a year to be able to have any ability to choose at all.
I'm so keenly aware, Sam, of how much in this context we're so similar.
Mhm.
Oh my God, everything you're saying, I'm like, yeah. Dish on the
Hmm.
sink, yeah. And it's I say to myself, I don't remember the rule, but it's not that I don't remember the rule. It's my nature to not know the rule.
Yeah.
If that,
Now, are you talking about at home, Vern?
yeah,
Okay, so you realize that my orienting myself back to this was
Mm.
because I need to know which of the two pieces that you now have identified, the out in the world or the at home,
yeah,
right? Because then if I don't ask that question, I am now confused. And my confusion drags me in one direction, and the words that you're saying are dragging me in the other, and it's the ever widening gulf until I have nothing in my head.
yes. And also, that's another challenge. That's another whole thought that I don't give complete pictures when I'm talking.
Complete, what does, okay.
Like, so you can understand really what I'm talking about. I go to like the middle somewhere and don't have the beginning, middle, and end of what I'm saying. I don't know.
The beginning, middle, and end are the story. The place you go to is the scene.
Mm.
a beginning, middle, and end are the story. But always realize there are ups and downs of both things, and the upside of a scene is when you get into the scene with the client, you are in the most active, potentially life-changing space with the client that you could ever be in. That's a complete opposite of generalizing in those times, you know? But
Also, Vern, and I don't to add on, you can be in neither the scene or the story. I mean, you
that's
can
correct.
speak, you
That's
can
correct.
so I say vague things to Clancy sometimes and she gets irritated because it's like basically nothing. It's like just a vague, nothing.
What,
It's nothing
give
to
an
hold on to for
example.
her.
Give an example, Sam, please.
I mean, I think last night or something, we were sitting, I was on the chair, she was on the couch, and I just said something and she was like, "What?" I was like photographing some t-shirts, and I would like messed up something in the thing, and she was like, "What are you talking about?" And I was like, I didn't even know how to explain to her what the fuck I was talking about because there was no scene or story to tell her to reference to even tell her what the fuck I'm talking about.
Okay, this was a nothing burger then.
But it was something to me, but it's just really bad in terms of,
Okay,
for another,
so
it's not for
you,
human consumption.
okay, that's interesting. So do
Well,
you remember this, Clancy?
I remember I remember you were distracted on your phone and you were trying to talk to me at the same time, but
Yeah,
you
and
were
you were
giving
like
the
trying to connect it to the TV show maybe, or you
I
were
don't
like
know.
trying to place it.
Oh, okay. First, Sam, before going forward in the story, pause and try and take in and picture Clancy's scene before. Yes, the thing you just said. That's wonderful. You remember a piece of the story and then. But then, if you do that and you go to and then with a scene first person, they want to kill you.
Well, I didn't even know I was so in my own shit. I didn't even know Clancy existed when I
Yeah,
talked. And
yeah,
when
yeah,
she talked, I almost was like, "Oh my God." Like I was not even.
yeah.
Yeah, we have like a wound thing about like I have
Well,
a wound thing about this.
they're not
That
listening. Wait.
it's a phone thing. I
It's
don't
a
know if it's a
phone.
wound, but I think I'm wincing right now, so
Oh
maybe
yeah,
it,
you are
yeah.
fucking turning purple. Yes, you are.
Biggest ones ever, phone. Yeah.
Okay. Imagine, you know what a tack hammer is?
No.
It's a tiny, tiny, tiny hammer that hits in tacks.
Okay.
It's tiny. The head on the thing is like this big. It's tiny. It's a tiny little thing, right?
I think I need one of those. Yeah.
Yeah, I was going to say, can you imagine having a little tiny tack hammer and getting his phone and just
Oh
turning the
yeah.
screen into Rice Krispies?
Oh yes. Absolutely. Like every square inch. Yeah, absolutely. Yeah.
Aha. Well, that's good. That was enjoyable.
That was. I like that picture, yeah.
Okay, now, one second, Eric. Now, when we're talking about doing emergence, that's what just happened now. There's no fixing that happened. What did I do? I helped Clancy to have some visual material
hmm
for a place where she wasn't having any visual
Right.
material.
Because I winced. Yeah.
Now consider how simple a description is of making progress in a therapy session. You have now discovered this place where the person can't picture, and it's a place. It's not places. It's not a category. It's a place. It was an actual thing. Okay, Clancy?
I'm just I get confused about knowing exactly where the wound comes from because to me it's not the phone, it's more him prioritizing the phone over me talking in the
Good,
room.
good,
So how do you know it's about the phone and not about the
good.
attention or where do
Okay,
you start with that?
and the answer is not going to be satisfying, but because
Okay.
the answer is it doesn't matter.
Okay, fair enough.
No, 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 but no.
Okay.
But
Sorry.
then it should be a pair of opposites where you go, okay, Steve, it doesn't matter what does matter.
Right.
That's the question that should then come. It shouldn't be you just accept me saying it doesn't matter. That's
Yeah.
a dictionary thing. That's a no. That's a
Yeah.
layer two thing, right? So what does matter is that if I experiment with the tack hammer, where I'm getting you to picture a little tiny brass hammer and a tiny little brown handle and it's wood and it's tiny. The little tiny head is tiny. It's just to put tacks into something.
You know what
It's
I just
something.
thought is like if it were a specific person that I felt like he cared about more than me, if I was tacking that person's name or something, then it
Okay.
would feel, does that make sense? Like if it was a
Oh
phone
yeah.
call with a certain person that I felt like, oh, he wants to talk to them more than me, that would give me an emergence, I feel
Okay.
like.
All right. So
Yeah.
how about this? All right. So he's talking on the phone to a person who you believe he wants to talk to more than you.
Yeah.
Okay. Now, you have shoes on. What sneakers? What kind of shoes do you have on?
In my picture, it's high heels. I never wear high heels, but it's satisfying, I feel like, with the high
High
heels.
heels. Okay.
Yeah.
Now, there's a sole on the bottom of the shoe. I want you to take off one of the shoes. What color is the shoe?
Black.
Great. I saw a black one too. Now
Oh,
you
cool.
turn it over, and can you see the bottom is leather? It's brown leather, light brown leather
Yeah.
on the bottom. Can or not? Can you see a different color? What color is the
I
sole?
just see like a tack hammer on the heel.
Okay. What I want you to do
Sorry.
is I want you to see in your hand,
Sure.
right, a black Sharpie pen, right? And you're
Okay.
going to write the first name of the person he's talking to on
Okay.
the bottom of the shoe.
Okay. Yeah.
Can you
Mhm.
picture having written, look at the bottom of the shoe and the person's name is there. Can you see the right
Yeah.
black letters on the tan?
On the brown. Yeah, the
Okay,
tan.
now
Yeah.
put the shoe back on.
Okay.
Right, now stand up right in front of him while he's on the phone and begin to grind the shoe into the floor. Grind it. Grind it. Twist your foot. Right? You want to like get this to the point where you erase the black name right off the shoe. You've ground it right into the floor.
Okay.
Now you pick up the shoe and you can see, boy, there's this worn area on the bottom of the shoe and the
Mm.
name is gone.
Okay.
Right. Okay. Now, that's a tiny piece of doing it,
Right.
right? So does it matter whether it had anything to do with a shoe or a Sharpie pen or the name? No, it doesn't matter.
Mm.
It is simply getting you to picture within that context,
Yeah.
within the situation. Now, I happen to know something now because I have a pair of opposites here. On the one thing, I got you to break the screen into Rice Krispies with a tack hammer, and in the other thing, I had you write a name on the bottom of the shoe.
Yeah.
Now, I can see one has juice and the other one has nothing.
The second one had less
Nothing.
juice, right?
Not basically nothing.
Yeah. I was
Right.
surprised by that.
Right. You were surprised. Good. So now can you see that when you ask the question, about, well, what if it's not, what about the original scene and what if it's not the phone and this and that? Well, what I just did is how you know. You
Right.
do a few different scenes and the one which has the juice, I know it involves a phone because holy shit, look at the smile on your face.
Yeah. Yeah.
Right.
It's interesting because Sarah had so much juice for the second one. She
Mm.
was fucking rocking in that
Oh, really?
visual. Yeah, she
Wow.
was like loving that one.
Oh.
Right. And so Sarah has an injury about somebody's name being somebody that a person that she was interested in, they liked this other person's name. Like,
I just love the idea of like being able to write people's names that you're just like want to be like fuck you to, and you just get to walk all over them constantly, like
yeah,
literally bottom
yeah,
of your.
yeah.
I love that. But like when Clance had the phone and I had the shoe, what does that indicate? Like it indicated for you that the phone really does have
Okay.
something.
What Clancy asked, the general question is, but what about the original event?
Yeah.
Right? We see something where a person can't picture, and it's a sudden onset. It's painful. It's an injury of some sort, right? And there's a huge reaction. Okay, there's that. All right, but do you actually need to be able to say, oh, the original thing was somebody was on a phone? Well, I wanted to talk to them, and the answer is no. I have the scene. We can work with the scene, and so in the scene, because Clancy said stuff about the phone, he's on the phone. I then draw from the words she used and go, okay, well, let's see what happens if I get her to get mad at the phone. Right. So maybe there was no juice. And then I would do something different where I would get her to do, yeah. The big deal about that would be if you had a name on the phone.
Get out your tack hammer.
Yeah, yeah.
Okay. So anyway, because we have like half an hour left, a little bit more. How about we go back through this and tell me, any of you, and this is not a test, what what sense have you had about anxiety? What have you learned about anxiety? And what other things, like general things, basics about emergence, maybe things you take away? Anything at all? I'm curious with you, Sam, because I know that there was a whole bunch of stuff that you contributed, but there were also a few things I think that you hadn't heard before.
Yeah, I mean, right in the beginning, almost in the first minute, you said something I never heard, which is that being upside down is one of the most primitive types of anxiety.
Oh, yes.
Um, yeah, it was even yeah, I scanned my mind for pictures of little kids being upside down, but all I could see was urgent me states and stuff. But tons of personal stuff about uh just all the kindness I probably missed out on that comes to mind in a kind of a sinking feeling like, oh God. And I
Oh,
started flooding in with the pictures of how confused some people might be when I'm acting afraid and worshiping them as if they're this punishing person. And like probably they feel strange or even making some people feel like monstrous because of how
mm,
scared I seem to be of them. And they're like, I saw a lot of pictures coming in for like really just ways that that wound has hurt me, but also hurt others, and just so that's the most personal stuff. But lots of little tweaks about emergence too. Picked up a lot of
like what?
little refinements and stuff like that. Um, the stuff about the socialization, little refinements to socialization to minority and majority, like the you know little visual tipping points for flipping people upside down. Like I never thought about like, well, what flips a person upside down? Why would someone flip upside down? And I'm wondering, of course, open question, are all flips caused by a wound chain? This is like one of the things I've asked. Like,
Now let's pause. All flips are caused by something that equates to a larger than normal wave. Whatever the
okay.
wave is, it can be an injury, it can be a life event, it can be a series of life situations like Eric's thing at the animal hospital. But eh, it's simply you're at the ocean by the shore, and a larger than normal wave comes and knocks you down. My understanding that every 13th wave is larger than the rest. I don't know if it's enough to knock you down, but
Hmm.
whatever. There's something in physics about that.
Hmm.
So flipping upside down can be that you walk into a room where you have been in a group of twos, and you walk into a restaurant and the person who is seating you is a one.
Hmm. Yeah,
Bam, you're hit
I've
with a
had that.
wave of negative energy, or me state energy, or whatever you want to call it, and you can flip. And then you go and you sit down and you feel odd about, I don't know what I want to eat. I don't on the menu, because you can't figure out what you want. And you didn't realize, like, oh, the energy of the person, man or woman, who was at the desk in the front, he was a one, maybe he's a T-Rex one, maybe he's having a bad day one, and that energy is, you sense it, it's larger than normal, and it knocks you down. Anyway, so in it, what else, Sam? Like you said, a bunch of refinements.
Yeah, and then other personal stuff. That exchange with Clancy about the stuff was really meaningful. I mean, that was
Yeah, like just like thank God so you were there to just be like, do you realize Clancy was being kind? It was just I did not. Yeah, I didn't know that at all. I was just like in I was lost in the story of all those pictures and I don't know if defensive is the right word, but just I don't know, kind
Yeah.
of
Oh,
beat down
okay.
and defensive.
Defensiveness arises as a result of anxiety.
Yeah.
There are no human beings who don't get defensive. How you get defensive, that may vary based on the age you regress to or the situation you're in or this or that. But there are, when we're suffering, we're going to defend against it continuing, whatever that means. The defense could be you shout stop at the person who's saying things to you. The defense could be, you know, apologia, the Greek thing for from logic, the explanation. It's not a sorry. It can be, wait a minute, and this is what's happening, and so on, right? There are many defensive things. Explaining yourself is one. Saying a socialized empty sorry is another.
Yeah, I
Um,
think knowing emergence is so painful. I got Vern was sort of talking a little bit about the just not seeing something. Like Clancy's suffering because I didn't see something. I know that it's I literally didn't see it, so it's like there's nobody to blame. But my God, it's so painful though. It's like a nightmare.
so this may be something really important for us to talk about in this, last half hour, which is the idea that often when we're in that situation, those kind of like you at the post office, right? Or you at the animal hospital. When we're in that situation, we're acutely aware of what's happening inside us, and we're doing all this, internal worldview simulation of what's happening in our heads, but we're not aware of the effect that we're having on other people outside of the simulation. We're
Mm.
not aware of, like, for instance, if we flip, that the other person is going to likely flip with us. And if the other person is the opposite, like they're three and I'm a two, okay, both of us flipping will put us in the same kind of need to give to each other, and that's a clusterfuck. No, let me give to you. No, let me give to you. No, or with a one where they then turn into a T-Rex and they're demanding that you worship them. Get down on your knees and worship me. You see that you're so selfish because you're thinking of yourself. You're so selfish. I lived this every day for 19 years with my ex-wife. Almost every day she told me I was selfish. And of course, it's not a surprise that I came out of that, divorce going, I'm the most selfish man on earth. I mean, whatever. It's like what you eat affects your health. And so what you eat, spiritually and verbally and so on affects your health. You believe it after a while. Yeah. And again, this is observation. This is not saying people can just be different. It's not. I think that the pain, what you really spoke about, Sam, knowing emergence takes away a defense, partially, mostly, right? But takes away the layer two explanations or the blaming. And those things depersonalize what's happening. The minute you say you are, or you do, or you always, or you never, or whatever, all that stuff, in some way the anger is there, okay, you're feeling something, but it depersonalizes it as opposed to just seeing Jesus. Maybe the other person's being kind to me and I can't see it. Oh, wow. Wow. And when we talk about things like ones, I often hurt about how people then weaponize the idea of somebody being a one rather than say, wait a minute, if a person is a one, do you realize they live their lives in anxiety about not getting? And we don't walk through life giving to other people constantly. It's not healthy for us, but it just doesn't happen. And so, but a person who's a one, if it doesn't happen, they live in constant anxiety. It does not give them a license to get and to mistreat us, but it isn't about that. It's simply what's the nature of a person who's a one or a two or whatever, as opposed to, look at that fucking person, blah, 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 which at times is understandable, but, I look at myself at times and go, look at me, I'm a fucking two. I'm fucking giving up my needs again, you know? Uh, Athena?
This whole 3 hours is just amazing. It's just I'm gonna have to watch it all over again because I wasn't present for the whole thing, but
All over again? Let me tell
all
you.
over again
Okay, I
and
think
over again,
multiple times. I mean,
over again.
I'm already, as we were doing this, I'm already thinking, um, a master class in emergence therapy is the title of the video as I post it, because this really is a master class in what this is, really. And I know you have some more to say, Athena, but I would just add, each one of you should then use your ability to follow this 3 hours as a measure of how much you've learned. If you're following, you have learned so many aspects of emergence. So despite whatever you think about what you don't know or how much you're missing or all the rest, if you followed even parts of this, do you know what it would be like for a person who has never learned any of this to watch what I'm doing? First, they would get lost constantly. Second, they would probably be feeling all these urges to write everything down and then memorize it instead of like write things down and then review it later and then like watch the video and see, did I write this the way it was or whatever. This is a lot.
It's like we were talking about imitating the great therapist rather than,
Hmm.
so like learning emergence instead of being whatever it is that we're being, right? Instead of just to try to imitate an emergence therapist. Like that's my biggest fear is that
I
people are
think,
going to try imitating.
yeah, I agree, Athena. I agree. It's my fear as well that it gets to be imitated, and then people claim that that's what they're doing. And I that's one of the serenity prayer things for me. I have to let it go. I have to, allow for the possibility that there will be people like all of you that will want to genuinely learn this, you know.
I
But
have a question
yes,
regarding the whole anxiety and going and the flipping, right? So as assuming I'm a two, right? Which
provisionally you are a two,
provisionally I am a two.
right?
Um, so when I flip, I'm compelled versus just the
That's
urge to
correct.
give.
So
Okay.
since you're a two, you're a you than you. But
Hmm.
when you flip, two things happen. But the main thing, which was what we said at the beginning, is that when you flip, it is because a wave of anxiety has hit you, and your automatic response, your programmed, your personality, it is just you. There's no, this is just the urge. Your programmed response is to give in a desperately major way. Desperately. If I give, then this will be okay. If I
So then the only way for me to get out of it is to recognize that I flipped, is to be able to see that,
Oh,
right?
okay, wait. So slowly. Okay. Athena's question, I'm going to break it into two opposites. The only way to get out of this, okay, when you say
Okay.
only, okay, immediately realize it's not a pair of opposites, but it's a starting point because she's in effect saying the topic. The only way to get out of this when you're flipped. Okay. So now, watch. because she's not wrong. It's just not hammered into a useful uh, 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 discussion. We have no starting point. So, the only way to get out of this by choice is to know your character type and that you're flipped. But it is inevitable that flipping will end, even if you don't know.
Mm.
So this is really what we're adding in emergence. Adding is not that people don't get out of it, that they don't get right side up again. Rather, that we have the possibility of even going and asking someone for help, and we can ask for something where the other person, if they know character type and they understand flipping, we can go to another person and ask for help and get knowledgeable help about this. Whereas if you don't know these things, then it's just something where people around you either don't do anything or they try and fix you. There's nothing to fix when you're upside down. It's just simply like wiping a young child's nose when their nose is running. It's not like you're going to fix that. It's a response. If somebody's upside down that you care about, and they ask you critically, and they ask you for help, then now there's a chance that you're going to get right side up. There's a chance it's going to be done with kindness. There's a chance that both people will feel good. Sarah?
So when
Okay. Wait, Sarah. Yeah, go ahead, Athena.
so if when I don't have access to someone who knows character type,
Yeah.
never mind. So that's not okay.
No, I'm going to answer, but you're not going to get any clarification, and then I'm going to call on Sarah. Okay?
Okay, no. That's
No,
I
no,
realize that's not the question I want
no, but I want to,
answered.
you have stated it, so you're fucked now because you put it out there and you can't retract it. People have heard it. You need to see you have an effect on people when you ask a question, even if you then later decide it's not quite the question I wanted to ask. The chapter, I sent out for the first 4 pages of the draft of the chapter, the last chapter, not the appendix, in the new book, which has it talking about bifurcation. And bifurcation is splitting a natural thing into two natural opposites. That's what the word means in our use of it. You're saying, say your question again. I want to use your words.
What if I don't have access,
To another
I
person.
think, to another person who
Okay. So here's what
understands
I'm going to
this?
say to you. The rest of that chapter, past those 4 pages, talks about how there is the literal other person out in the world, but there is the internal worldview other person, and it describes it in depth in this chapter
Okay.
about when you don't have the other person, you have an observing self and a suffering self. You have an adult self and a young child self. And when you can see that and know about that, then you have another alternative in those times where there's no other person with you. Your real question?
Okay. So the real question was, you also had mentioned that when I'm flipped, something about the people around me flipping or causing
Yeah,
someone
there's
else.
no doubt about it.
So when I as a 2 am flipped and I'm compelled,
To give.
does that mean if to give, if the person that I'm with is a 3, wouldn't they be compelled to flip
Okay,
to
no,
a youth
you don't
type?
get compelled to flip. A wave of
No,
energy
not
hits you,
okay,
and they
right.
feel compelled to get. So the more you flip with your ex-husband, the
To be.
jackal, right?
Mhm.
The more you flip with the jackal, the more he's compelled to get from you.
Got it.
That's you, Vern. The more that you flip with your husband, the more that your husband needs to get from you. I'm not saying any blame. I'm not saying you can change it. I'm not saying anything like that. It's just simply we're looking at the connection of when one person flips, what happens, how does it affect the other person? Now, if it's you and me, right, and you flip, if I don't right myself or if I don't help you get back right side up, if we both flip, then we're both falling over each other to try and give to each other, and it's a fucking mess. A mess. Okay. Sarah first, and then Linda, and then Clancy.
I think they had stuff that was like co-signing on that, but mine was gonna be, how we learned about contempt
How you
versus
learn about what?
curiosity, and to get out of contempt is to get angry rather than like to get into the self and to like, is
Yeah.
it the same way
No,
where
you can't ask it. It's way outside the scope of what we're talking about.
no, but is it the way to like unflip yourself to almost
Yes.
like get,
Do you hear what's happening, Sarah?
you know,
I know. Can you see kindness for coming from me?
yeah,
Yeah, you seem reluctant because you're me first and you want an answer.
I don't.
I know. It's okay. I can see it. No, it's the topic. We have 15 minutes, and I really want to do kind of go over what we got here so that I embed it more. It's really good stuff to ask another time, Sarah. But the problem in emergence is everything connects to everything. So there's an infinite number of questions that you could ask about everything we've already spoken about.
Well, it was in response to Athena's, but okay.
Yeah. Linda, you're.
I'm confused. If a two is you, can a two ever flip into a neediness of needing or
Okay. When when
getting?
you when you become psychotic and you go into a me state and want to rip a certain person's uh, whatever butthole into shreds, you're reliving an injury, and we can know that the injury is coming from either the first year of life or the third year of life in you. Now, if the injury occurred when you were, say, 2.5 years old, third year of life, you'll be in a me state. It's not because of your character type, it's simply because that's the natural state of children in the third year of life. Even a two, they move into a more, I don't know what I would call it, you know, but when you relive an injury, even if you're a two, meaning you have no me in you, anybody can have a me if they relive an injury and it's early in life.
So I'm not reliving and I get really compelled. I
If
want
you're
to like
not relive,
extra give. I want to give
yeah, yeah,
way.
compelled to give, yeah. Like in other words, when you had anxiety at meetings a year ago or something, and I complained to you that you didn't sit still and like enjoy the meeting, right? You were compelled to give. You were compelled to give as responding to the anxiety that you felt about being in that meeting. So the anxiety flipped you, the big wave of anxiety flipped you, and your response, because you're a two, is that your second me state came online in a huge wave, and you felt compelled to keep giving and giving and giving and giving and giving.
Like at the retreat when I stay in the kitchen and clean and want to serve everyone instead of
That's right.
sitting with people and
That's
having
that.
connect.
Yes, Linda, that's 100%, and that's coming from a big wave of anxiety. And mostly people don't notice, they don't pay attention when they feel the big wave of anxiety and they just flip. But even if you didn't notice it before, you can know it in hindsight. If you flipped, you were hit with a big wave of anxiety. Yeah. Clancy?
It's okay. I'll save it because it's gonna take me too
No,
long to.
no, no, no. Please just get out the question, even if we don't do it.
Well, and then you guys, you might have said it already because I'm.
Okay.
The
No,
question is,
you're flipped.
yeah.
You're being too fucking nice. Would you just be a three?
Okay. The question is, oh God, I feel like I need more time and I'm pressured by the
Okay.
we only have
I
10
want
minutes.
you to take a breath and watch. We're all going to wait.
Oh no. Okay.
It's okay.
I don't know. Okay. So I think I'm confused because like for instance, if I um if someone's God, if someone is um God, I can't collect my thoughts. I'm like pretty flipped right now.
Okay.
Yeah.
Okay. I want you to breathe.
Okay.
No, but this is an example of trying to get yourself right side up because
Yeah,
you're surrounded by kindness.
I know.
Do you see any faces that look mean?
No. None. Not one. Yeah.
The only one is
Especially
yours.
Athena. Yeah.
The only one is yours.
Yeah. I
But
guess I'm sorry. I guess I'm confused by I feel as if someone was compelled to give with me,
yes.
it would mostly flip me to want to give back to them and I wouldn't go to wanting to receive more. And I think I'm
Yeah.
confused about the direction in
Oh,
which it
okay.
goes.
Good. Excellent. Excellent question. Okay. So provisionally you're a three,
Yeah, I'm pretty sure, provisionally.
a me, then you.
Pretty sure, yeah.
Okay. Flipping means you go to the secondary state.
Sure.
Your secondary state is you.
Yeah.
You would be compelled to give back.
Right.
You
So
wouldn't
okay,
be
so
compelled to get.
we're
Right?
flipping to our secondary state.
When you
Okay.
flip upside down, you flip to the second state in your character type.
Okay, I didn't realize that that's it was a I because I know the first and the secondary state. I didn't realize we're always
To,
compelled.
to,
Okay, I see.
yeah, to compel to give. Now, when you are compelled to get, like Linda when she's compelled to get, in both cases, you're reliving an injury.
Right. Because I don't have that state naturally. Yeah.
You don't
Okay.
have, the secondary state is not me. Therefore, the secondary state is not compelled to get. If you were a
Okay.
four, if you were a four, the secondary state would be you then me,
You know
and the
what
second.
yeah. What confused me was Athena's husband because I thought he was a three. So when you said when Athena gives to him, he will want to get more. And that's what really confused me was why wouldn't
Well, it's a
he?
That
little
confused me
confusing
too.
about whether he's actually a three.
Right, because that's what made me think, oh,
Okay.
is he a one and what do
Provisionally,
I do? Yeah.
please take this with the word, Athena. Provisionally, I think he's a one because of that thing about the compelled to get. But I don't know. That's why I said it. I'm only giving an explanation for why I said it. That is it.
Okay.
Yep.
All
Because
right.
because now think of my evidence, Athena. When you're flipped upside down and you're compelled to give, he doesn't do what Clancy would do. And so, in some sense, I am now the question has come up in a way very powerfully. Why doesn't he do that? When Eric flips, he's in the compelled to give. When Sarah flips, she's in the compelled to give. When Vern
Yeah,
flips, she's
I've
in the
never
compelled to give.
I've
Here are
never
all these
seen him in a
examples,
state where
right?
he's
All these examples of people that are really we have lots of good observations. They're good observers themselves, and yeah.
I actually have an answer because I have seen him in a state. I was going to say I've never seen him, but then I realized with his mother, I have seen him in a state to compel to give.
Okay, I am going to say to you, but you need to take into account whether it's an injury. If he's reliving an injury from the second year of life, he can feel compelled to give even if he has no you in him. Linda doesn't have a me in her, but when she's a psycho, she's in a me state. Period. When she's
Yeah,
not,
there's infinite exceptions to this. Like anybody could be in like if I'm in a really crazy state and then Sarah's flipped giving to me, I could urgently take from her. I mean, it's not it's just like,
it,
anyway,
the
I guess that
difference.
should be said. It's not like absolutely black and white fixed. It's not
Okay,
like that.
let me pause because the confusion needs to be addressed in this last remaining minutes. The confusion is the difference between being upside down character type wise, which always means you go to the secondary state and you feel compelled to do that, whatever the secondary state in your character type is. The confusion is how do you know the difference between that and a person who is reliving an injury. And I'll give you the beginning of an answer. You hear the beginning word? It's how quickly you change. When
Yeah.
you get knocked down by a wave, there's a process. It takes an amount of time. It may be brief, but when you relive an injury, it's as if it's a bad splice. It's instant.
Mhm.
The change is instant.
So now I'm looking at the evidence. Well, you know what? We can discuss this on Wednesday.
Yes, but the point I'm making in general is because of you and because of Clancy asking this. She's asking
Yeah.
a question that's really a critical answer,
Hmm.
which hadn't been addressed, which is what's the difference between something happening because of your character type and flipping upside down, and what's an injury? Because
So
both
when
things can result in compelled to give or get.
Linda goes into goes into a state where she's compelled to get,
She's reliving an injury.
so that flips happens quickly.
And the
It's a
flip,
flip.
Mhm.
oh, oh, Linda, how quickly do you have to see the derriere of a woman in tight jeans, right, with blonde hair and a ponytail
Right.
walking away? How quickly does that happen?
Instantly.
Right. In other words, it's like she's never been anything else. She's the psycho queen who's going to execute her boyfriend on the spot, no questions asked. Look at her. Right.
You,
But when she goes to have to clean at the retreat, that's not what happens. This is like this strong urge that develops, and then, like, to get her to change out of that is strong. Okay, Linda, come on, join us. Come on. Okay, I will in a minute. Okay, I will. But there's nothing of the abruptness.
Mhm.
Steve, I tried
I
to get him
just
to look in the pizzeria again and he wouldn't.
What's that?
I tried to get him to look again in the pizzeria and he wouldn't. I think I've healed because I'm pushing him to look now.
Okay, you have healing there. You have healing. I know you have a piece of like, think of what you're telling me. You're
I
literally saying, "Hey, Chris, will you look at this thing that used to make me turn into the fucking witch?"
used to make me flip instantly.
Yeah, okay. But the point we're making is the difference between you're going upside down with your character type and reliving an injury is that in both cases, you are going to be in a state, either a me or a you state. In both cases, you can be compelled to give or get in that state. But the onset speed is the difference. One is gradual, and the gradual might be 5 seconds, but 5 seconds is a big difference between that and instant.
I'm going to gather more evidence, but I do believe that when he's interacting with me, he's reliving injuries with his mother, which is why he projects his
Okay,
mother on
but
me so much
let
because it's
go. Here's
instantaneous.
the thing. Here's the thing.
Let go of
Don't
the fact that he's a 3.
don't infer.
Mhm.
The minute this is how this is the hypothesis thing. This is what conventional science does. They say you must start with a guessed answer. If you guess
Mm.
the answer, you're looking for confirmation bias. You're already biased.
Yeah.
Do your best to not do it. Just look at the evidence. And I used a secondary piece of evidence when I thought about what I said, which is that I have not seen him in a frequent way get upside down where he's compelled to give. So where's my obvious thing? Vern, Sarah, Eric, Clancy, every one of them. This is something that happens regularly and frequently in some situations.
But I have seen him in that state
And that
repeatedly
state
with
has
Claudia. With
nothing.
Claudia.
Okay, you're doing something which is you're trying to know ahead of time.
Oh,
Athena, you don't have enough evidence. What I'm telling you is, I have a piece of evidence that he's not generally like that, and all the threes in our community are. That's only an observation. I'm not even declaring this. But when it comes to knowing which is an injury and which is you flipping upside down as a character type, The difference is the onset speed. I'm giving you the information that could tell you the difference, and you're guessing what it is without looking for that information. Onset speed. And you heard Linda talk about it. You know, I know, Clancy, the phone thing is an injury with you.
Mm.
I know that, and where's my evidence? Well, one of the pieces of evidence is it had juice when I had you destroy the phone.
Yeah, yeah.
In other words, when we're doing this, we need more than one piece of evidence. There's a thing in the testing, in the book, first book and the second book, where it says, how do you administer tests in Emergence? And it says that every test must be administered in both a positive and a negative version of evidence gathering. You have to see what it's not, and you have to see what it is. Both kinds of evidence. Not for today, that's way beyond what we're doing today, but you need both kinds of evidence. So I got that with Clancy because I got what it was not, the
Mhm.
shoe, and the name, and what it is, the phone. And I gathered evidence. That's not me saying, well, I'm all knowing and certain right now. It's just that the evidence I gathered both kinds of evidence, and it
Yeah.
strongly points to blah. Anyway, anything before we go? This has been an extraordinarily good. This
Yeah.
is one of my favorite groups of all time because, yeah, because it just has been.
Me too. It was awesome.
Me too. Me three.
Me
All
three.
right, all of you.
Thank you.
Three.
Bye,
I'll
everyone.
post it soon. Okay. Have a good day. Bye.